Full meeting this evening, Monday, February the 27th, 2023. I'd like to remind everybody that meeting participants be advised that the meeting is to be recorded for public access broadcast. With that, I'd like to call the meeting to order and have a motion. Do we do a motion?
No.
And then we're the adoption of the agenda. Any conflict of interest declarations? Oh, do we have a second? Seconder, all in favor?
Aye.
Contrary minded? Jason, Councilor Black, sorry. Contrary minded? Motion carried. Conflict of interest declarations?
I have one, I'll fill it out.
And with that, we will move on to new business. And a presentation by Ambulance New Brunswick, and we have Ronnie Alain and Benoit Savoie that are with us in the audience, and they're gonna come forward and do a presentation for us, which I believe we will have on the display that will be available shortly. How are you today? Thank you for coming.
Thank you. Where's the best place to sort of stand? I don't know where you're.
You're good there.
Whatever you guys feel comfortable with.
The camera's catching you.
It'll follow you.
Closest to the doors. You know, between.
I'm the local manager for the Hillsborough district that includes Salisbury. Ronnie is my regional director. He has lots of experience with those presentations and kind of present everything and have any questions or whatever it could be, is doing it a lot. And so I kind of ask him for his support tonight. I'll just sit, and if there's questions and stuff, I'm here around to answer any of them. You probably, most of you, have met my wife before. Chantal Wallet, she was work for the RCMP. She always highly talked about you, and I know she was involved a lot in your meetings and stuff, which I certainly now with that new whole different system, I talk with Austin regularly, and I really want to be part of anything can help. We're giving a service. Sometimes we provide best service. Sometimes, well, it's maybe some points to improve. Ronnie just as me, I'm very eager and open for any improvement if there may be. On that, I'll let you know.
Like Benoit said, my name is Ronnie Alain, Eastern Regional Director for Ambulance New Brunswick, my office out of Moncton. And very pleased that you guys have, reached out to us. Ben and I. We'll go through a presentation. Now, I was looking at your agenda. You've got what I would say is a pretty heavy agenda. So what would be sort of your timeline for this presentation?
You tell us.
Okay.
You tell us.
You can be really fast.
Yeah, I say make it fast and then leave it to questions for them, I would say.
We'll go through the slides as just so to sort of corral me and Ben, because we get off on tangents. Next slide, if you can.
There we go.
Maybe.
It's gonna be real
There we go.
Yeah. Now we're done. One slide. So the thing that we'd like to cover tonight is a little bit of the organizational structure of, Ambulance New Brunswick, some SSP dynamic deployment. I'll explain what that means later on. Some of the challenges within healthcare, including Ambulance New Brunswick, extramural, some of the solutions we've been working on, and some accountability piece. Next, thank you. Now, it's a little bit fuzzy. Oh, there you go. Benoit and I work for Medivie Health Services New Brunswick. Medivie Health Services New Brunswick reports to Medivie Health Services. Medivie Health Services reports to Medivie Inc. So Medivie Health Services is a sister company to Medivie Blue Cross. So the governance component is through Medivie. Ambulance New Brunswick, EMA and B is a government portfolio, if you will. So the Minister of Health is responsible for the Department of Health. Is that just the clock, or is there somebody at the door?
Ball in your presentation.
and I'm French, so, you know, talk about disclaimers and conflicts, bear with me. So, so the Department of Health is responsible for ambulance services. So if you look at the bottom, the red boxes, they're extramural and ambulance New Brunswick, and, they report to EM A and B, extramural ambulance New Brunswick. And there's a board, there's an A and B board, and there's a lot of government, stuff. I can't really see the slides from here, but there's a patient safety committee, there's a finance, performance committee, there's a medical oversight committee, there's a governance, part of it, and it's all either government or the board that look after these things, so Benoit and I, as, you know, Medivy employees, we manage the system day to day, and we have a contract with the province to provide the service, but the paramedics are government employees. The assets are either owned or leased, by government, and where health, Medivy Health Services, a Medivy company is nonprofit, we can't own assets, so a lot of the buildings are either leased or owned by government. It gets complicated, to say the least.
Seems a little top-heavy, if you ask me, but that's just my opinion.
Well, there's like 2,000 people under that, so this is the governance portion of it. The big item, I guess, for me in New Brunswick, when this was created back in the mid-2000s, is that where government has, you know, the committees and the legislation and the employees, if Medivy doesn't do a good job, and government gets rid of Medivy, Benoit and I are gone. But, you know, all the paramedics and the ambulances and the stations are still there. So Medivy doesn't have, you know, a monopoly on it, if you will. So that was a really good, safeguard from government. But anyway, so, next slide. Before ambulance New Brunswick, 2007, the Department of Health was negotiating 52 ambulance contracts in New Brunswick, with 38 different operators for land, 1 for air, 2 for dispatch. It was very time consuming for government. There was a lot of inconsistencies in the system. Some ambulance services were managed by hospitals, some were municipal, some were volunteers, some were private for profit, some were private nonprofit. The training was different, the standards were different, the pay was different, it was very inconsistent. So where you call 911 from, or whoever responded to your emergency, you really could get a different level of care. And that local service would have had a different budget and stuff like that. So that was one of the things before ambulance. Thank you. With the creation of ambulance New Brunswick, part of the reason government did that is to, you know, economies to scale, different benefits. So, one single point of contract for government, one single dispatch center for the province, one set of protocols for the province, one set of standards, one set of salaries. So every paramedic in New Brunswick, you know, earns the same amount of money regardless of where you work. Every paramedic has access to the same ambulance, same equipment, same training, same funding, same uniform. So that was a big deal for government, and that was a sort of a big plus, I think, for the citizens of New Brunswick, because everybody gets the same opportunity. Before ambulance New Brunswick, you know, for a long time, Petitpoudiac, Salisbury, it was volunteers. They did fundraisers, so their money came from, you know, fundraising. But if you were in St. John, they had ambulances with like mag wheels and stuff like that. Like, it just wasn't fair.
You know, you're gonna get sent to it, St. John.
Not to pick on St. John. Next slide. Some of our achievements, ambulance New Brunswick was accredited by Accreditation Canada in 2018. We've recently gone through our second accreditation cycle. We got an accreditation score of 97.4, and it relates to an exemplary standing. We're the first ambulance service in Canada to get that standing. And Accreditation Canada looks after accrediting hospitals, ambulance services, all of healthcare. And they look at a lot of things, policies, procedures, protocols, training, infection prevention, risk mitigations. There's 300 and some points that they look at. It's like big binders. And they said that we're doing a good job. Pretty happy about that. Now, Ambulance New Brunswick, some of what we are, who we are, what we do. We do 911 ambulance response. We have an aircraft. We do transfers between hospitals and nursing homes and so on. We have rapid response units and advanced care paramedics. The air ambulance, there's a hangar at the Moncton Airport, and there's a contract with Voyager Airways from North Bay, Ontario. They provide the aircraft and the pilots and the hangar. Ambulance New Brunswick, in conjunction with government, provides the medical staff on the aircraft. There are 2 aircrafts in the hangar. One's on duty and one's available if the other one goes for maintenance. So the second one is not on call, but there's a lot of maintenance to an aircraft. So there's a spare aircraft for when the primary aircraft goes into service. A little bit of background on. In the early 1990s, New Brunswick, Nova Scotia, PEI went into partnership to try to get an air ambulance program. And there was a big debate on fixed wing or helicopter. They eventually went separate ways. New Brunswick went with a fixed wing and Nova Scotia went with a helicopter. All kinds of reasons for that. If you're curious later, I can fill you in a little bit. I'm not the expert, but I know that there are some advantages and disadvantages to both. We also have a contract with a private air carrier in Graminan or on Graminan, on the island. And we have an extra paramedic on duty that's a flight paramedic for Graminan. And the minimums for taking off versus the minimums for landing, it's easier to take off than to land. So there are times where the air ambulance from Moncton could not land in Graminan, but that aircraft can leave the island and go to St. John. Now, they might have to stay in St. John until the fog clears or whatever, but there's an advantage to having that aircraft there in Graminan, so they're a little bit different. The rapid response vehicles, they can be, either Subarus or Dodge Durangos, and you might see them around a little bit, but they're mostly in Moncton and certain rural areas. This is a geographic overview of the province. You might not be able to see all the names, but our ambulance stations are basically where the population is. Those are where the highways are. A little bit of background on that as well. Prior to Ambulance New Brunswick, the ambulances were, for the most part, where the community got together and did fundraising and had an ambulance, either through St. John Ambulance or Red Cross. There was a lot of St. John Ambulance in New Brunswick back then. They also did a lot of medical first aid events and stuff like that. So when the government said we're going to one provider, Ambulance New Brunswick, the Prime Minister said at the time that nobody would lose their ambulance. So our ambulances are where our ambulances were. So we're not sure if that's where they should be or need to be, but that's what we have to work with, and we want to honor that to make sure that, all that work that those people did prior in fundraising and all that gets recognized. So that's why that looks like that. SSP and dynamic deployment. The SSP, it's an acronym for System Status Plan, and the dynamic deployment is the movement of the ambulances. I'm not going to go into a lot of details, but we use this a lot. And basically what it means is our dispatch center has a set of rules whereby they move the ambulances to balance the coverage. So if we have so many ambulances in the province, this is where they go. If we have so many, this is where we go. This, and so on and so forth. I've embedded a video, just hold on a sec. I don't know if you'll be able to access it or not. If not, I'll bring you my thumb drive back. A few years ago, there was a bus crash in Rexton, New Brunswick. It was in early December, hockey team coming back from a game in Trackety up there somewheres. 30, 40, young men in the bus. Flash freezing, black ice, they rolled in the ditch. And it was about shortly after midnight, maybe 1 a.m. So some folks at Edmonton Brunswick in our IT department gathered telephone recordings, radio recordings, and map movements, and they condensed, I think it says so in the video, but they condensed like 3 hours into like 2 minutes. So what you'll see on the screen, if it works, is the ambulance movements, and the little dots will be ambulances, and they're color coded. If they're green, they're available, and if they're red, they're on an assignment, and you'll see them moving around. So it's just to explain a little bit of dynamic deployment and system status plan, how things move around all the time, like. And if you ever need to, investigate something, the timeline is very important, like 10 seconds can make a big difference. Because you don't know what the future brings, and the future doesn't have, so as things come in, the plan gets adjusted. Can you click on the screen to see if it's gonna play?
Have to go to the next one.
Okay,
Because you saved just PDF, so.
yeah, I'll bring the thumb drive back, and I think you saved it to
And a
PDF.
PDF, yeah.
Yeah. I don't know if the folks online will be able to see it. I think it's media. Can you play it from there, or do you have to download it?
At 2:27 a.m. on Saturday, December 8th, 2012, Ambulance New Brunswick received a call regarding a bus crash near Bouctouche. 9 ambulances responded to the scene. 19 additional crews were relocated throughout the province to provide a balanced coverage. 10 patients were transported by ambulance. What follows is 4 hours of ambulance activity condensed to 2 minutes to show the dynamic deployment of ambulances that occurred following the initial call to 911 for this accident.
School bus, about 18 passengers inside.
Okay.
And there's about 6 injured.
Rexton 580, incoming code 1 traffic accident on Route 11 in St. Anne, the Kent. Shediac 524 Medic Center.
But
I'll get you also to respond, code 1 traffic accident on Route 11.
604 going to send you Moncton Way as well as 561. 561, do you copy?
Lieutenant 519. If I could get you to head towards Black River roadside, please. Port Elgin 662, can I get you to start heading towards Shediac, please?
Port Elgin 662, on est en route.
Acadie 579, on vous a besoin des gouttes, s'il vous plaît. We have 4 ambulances on scene, 4 more responding, over.
I'm not on scene now.
10-4, and I'm to advise that the staging area is at the Stella Maris Hospital, over.
Thanks very much for all your help.
Thank you. Just want to confirm both medic from Mirror Machine 666, over.
4, we are.
Now, 4, you're good to head back to Mirror Machine. Thanks for the help, guys. Good job.
The
video gave me goosebumps. Like tears in my eyes.
Would it be evil?
I'm a scatterbrain, I'll leave without it. Be in the newspaper tomorrow. Sorry, that's a little bit about, if you could go back to the presentation, slide about.
Yeah.
I think.
Easier said than done.
So that's a little bit about SSP and dynamic deployment, how we move things around, and Ambulance New Brunswick does about 400 calls a day. That's, ambulance movements per day. Our dispatch center for the whole province is in Moncton on John Street. Thousands of radio conversations, although they've recently changed their dispatching software, which may have affected your fire department. rather not get into that.
Good idea.
Yeah, definitely work.
You know, we heard about that.
But I mean, it happens, so I'm gonna be honest. Next slide. So we have a lot of challenges. We have a lot of problems. The split screen's okay with me if it's okay with you guys.
Yeah,
So we have more calls, we have more demand, and there's another slide on it after, but just for now. Increased call volumes, increased demands, lengthier times to offload our patients at the hospitals. ERs, closures, especially in the summertime. We have staffing shortages, the hospitals have staffing shortages, nursing homes have staffing shortages. And it's across Canada, so it's not like we can, recruit from other provinces, because, other provinces are here trying to poach our staff. And then the pandemic with all of that. So, next slide, please. During the pandemic, EMA and B, Extramural and Ambulance New Brunswick, responded to a lot of special care homes, nursing homes, homeless shelters. They're not called, homeless shelters, they're called sleeping hard, something like that now. I apologize for that. But anyways, collectively, our team vaccinated over 60,000 folks that couldn't get to a vaccination clinic. We vaccinated folks at home. We had prompt responses, which is a provincial rapid response outbreak management team, comprised mostly of extramural, but also paramedic managers. They would go to nursing homes where there was a COVID outbreak. They would set up tents and shelters and isolation protocols and contracts with garbage disposal, contracts with food preparation companies, and it's not on the slide, but when the pandemic started, people that caught COVID-19, about 2% would die from it, 35–40% could be hospitalized. Now, luckily, we're beyond that, but the first few nursing homes that had COVID outbreaks, we had, as many as 40, 50, 60% of the residents dying. So it was significant. So anyway, it took a toll on our team, but they did great work. They responded to over 300 sites, and we're talking 16-hour days, 7 days a week, 3–4 weeks at a time. The mobile swap team, same thing. They would go to universities that had international students, foreign workers, all kinds of places that they would go to, so those folks could remain in isolation for the 14 days. So anyways, so while we do ambulance and extramural does extramural, there's some other things that we need to do, when the need arises. And we've also created the pre-hospital alternative low-risk triage, which is pre-alert. I'll see that on another slide as well. The pre-alert, you've probably heard about in some fashion. It's where we take fewer people to the hospital. I'll get into that after. The next slide. So our call volume over 10 years approximately has gone up by about 32%. Is that aging population? Is that fewer family doctors? Is that, ailing people? There's a whole slew of things.
All of the above.
All of the above. People are probably sicker. People probably require more of their family physicians, and family physicians probably don't work the hours that our old ones used to, the whole work-life balance. So I'm not, criticizing anybody, but it's a fact. We have challenges, all of healthcare across Canada and around the world. With our call volume increase of 32%, the government hasn't given us, 32% extra paramedics.
We ask questions just as we're,
Yeah.
so that really telling. and you may not know the answer, but, I mean, you mentioned aging population and
Mhm.
well, that's not getting any younger. By 2027, that's actually supposed to accelerate with the aging in the province. If they modeled any, if that's gone up that much in that period, it's only gonna rise even more.
I'll cover some of that in our solutions.
Okay, great.
Next slide. Another challenge is offload delays. Before 2017, we didn't have offload delay, and basically what an offload delay is, paramedic crew arrives at a hospital with a patient, gives a report to the team lead, charge nurse, or somebody in charge, and they don't have room for that patient right now, go wait somewhere. Last year, we had, in New Brunswick, almost 37,000 hours of paramedic crews sitting in a hospital with a patient.
Wow.
That's 37,000 hours they weren't on the street. So it's broken down a little bit, but it's basically almost 8 hours, it's almost 8 ambulances per day, or day night. Provincially, it's almost 8 ambulances that are not on the street. And we have around 90 on the roads during the day and about 70 at night. So it's a pretty significant percentage. And we have staffing issues as well. Next slide. These are just clips. I've got 2 slides worth of clips from newspaper articles, news agencies around the world, staffing, healthcare, pandemic crisis, staffing crisis, from Newfoundland to British Columbia. They have a protocol in Montreal that if you're like a certain acuity, they'll say something to the effect of, right now, we don't think we're gonna send you an ambulance for at least 10 hours. Not even gonna try to send one.
So that's pre-waiting for the emergency room?
Yeah, that's pre-waiting for the ambulance, pre-waiting for the ER room. Next slide. It's not a fear-mongering tactic, I'm just saying like.
This is reality.
Yeah, it is, yeah. So next slide. We have vacancies, we have short-term vacancies, medium-term, long-term, permanent vacancies, temporary vacancies. In the last 3 years, we've seen our vacancies from permanent. A permanent vacancy is basically an empty position that we can't fill. We've worked quite a bit, and like even Benoit does a lot of like job interviews, like colleges from different areas. We go to job fairs, well, there's a slide on that, but job fairs, colleges, stuff like that, we recruit. So we've managed to dwindle down our permanent vacancies, but our temporary vacancies have gone up. That's work safe claims, parental leave, stuff like that, but a lot of it is injuries, physical injuries, mental injuries, you name it. So as we work on one, we're having struggles on the other. So we've got some strategies for all of it, for what it's worth. Next slide. So some of our recruitment efforts, job fairs, we try to go to schools. We had a little bit of difficulties with the pandemic, but we're trying to go to schools, especially high schools, to, encourage kids to, take some science classes and to become a paramedic. Our HR department's got some ads on Indeed and LinkedIn and certain ads on Facebook and stuff like that. We've, posted with the Paramedic Chiefs of Canada last year, and again, in about 3 weeks, some of our team is going to Dublin, Ireland, and then Dubai to job fairs, and they're looking for paramedics. Now, a lot of people that work in Dubai aren't from Dubai. A lot of times you'll have people from Australia or something like that. So, anyway, so we're out there recruiting. Our HR department's also working on like exit interviews. Why are people, leaving? So we've got the recruitment part, but we also need to work on the retention part. yeah, they've hired somebody within our MetaV team for capitalizing on opportunities for recruitment across Canada. Now, our recruitment campaign, the Nova Scotia government just announced, a bunch of money for training paramedics. So that's gonna hurt us. They're training, they're recruiting, there's, possibly signing bonuses, so Ambulance New Brunswick actually had a similar proposal in to our provincial government before all of that, and it didn't go anywhere, so hopefully they'll dust it off now that, they're competing with Nova Scotia. We'll see. Next slide. Yeah, some of our career fairs. There's a paramedic expo. I think, Ben, you've been to that, anyway, last year was in Saskatchewan, I think, or Saskatoon. And local fairs, even like, Moncton has, job fairs for new arrivals, we go there sometimes. Sometimes we'll even go to, public safety days, emergency days, stuff like that within communities, to try to drum up some interest.
So for credentials, when you go into Dubai or going to Ireland, is there credential recognition that has to happen for people coming here?
Yes, but that's within our paramedic association.
Okay.
Paramedics in New Brunswick are legislated, and we're actually self-governed and self-licensed, and we can practice medicine. We can practice medicine even when we're not at work. But it's our professional association. There's a reciprocity component, and I think paramedics that take a course in New Brunswick have to write like a 300 question entry exam. But if you're a licensed paramedic in a recognized jurisdiction, there's like a 50 question New Brunswick specific, like the New Brunswick Motor Vehicle Act and stuff like that, but it's not on the medicine part.
Okay, thank you.
So yeah, some of the job fairs we went to last fall. Also working with Opportunities New Brunswick, and we'll see how that goes. Next slide. So the employee engagement part, we're not very good at that. So it's been identified. Our CEO and our president, do an annual tour to go visit, the paramedics. They do virtual town halls, sent out surveys to paramedics, and some of the surveys are direct correlation with accreditation. We get some of the questions from them. Employee recognition programs, long service awards, a vibrant, thriving community. I think, Ben, you were part of that community, and again, with the pandemic, some of these things have sort of
put a break on lots of things, but it's kind of kicking back again.
And we can do better at recruiting, but we really need to do better at retention. And it's a difficult job. And when you arrive at not to speak out of turn, but when you arrive at the hospital and they are equally as swamped, they don't have the resources or the personnel or the room to take your patient. And, we've had paramedics respond to a 911 call, bring the patient to the hospital, they needed to go. And at the end of their shift, another paramedic crew comes to relieve them. We now have contracts with taxi companies that taxi paramedics to go do shift change at the hospital. 12 hours later, paramedic comes back in for their next shift, gets into a taxi, goes back to the hospital to take over the same patient that they brought in yesterday. We've had patients on our stretcher or being looked after in the ER by our paramedics for 40 hours. And then it's hard to get them food. So then the paramedics are trying to order food from the hospital services. And depending on what the patient may have for an ailment, sometimes it's better to be fasting. But some of our patients are medicated. We've had paramedics, one stay with the patient, the other one take the ambulance back to the patient's home or nursing home to fetch their medications to come back to the hospital. Anyway, it's hard on our staff. And so the,
Oh, it's ridiculous. At the end of the day,
Yeah.
it's ridiculous.
it is, and it's nobody's fault, it's, you know, aging population, it's a growing population. So, yeah, we have, you know, a lot more people and, you know, we've got a tax surplus. But we need to implement, you know, the social networks that go along supporting these things. Next slide. So some of the things that we have done or we're working on or we're in the process of making better, the pre-alert program, that's the pre-hospital alternative low-risk triage program. I have another slide on that, but that was Amherst, New Brunswick government and the Paramedic Association of New Brunswick implemented in January of 2022 when we were still pretty, you know, heavy into the pandemic response. People that call 911, paramedics arrive, they do an assessment. You require care. You need some sort of assistance. However, you don't need to go to the ER in an ambulance. You know, how can we better serve your needs? How can we, you know, try to get you what you need instead of, you know, taking you somewhere that you're not gonna get seen for a long time? And that was rolled out very quickly, especially, you know, in government speeds. This should have been like a 2-year process and it was like 6 weeks. So there were some hiccups. We're already working on version 4 of it, I think. Now, the government has to help out and provide some of the alternatives, you know. But some of these things are, you know, pharmacists that can prescribe certain, you know, antibiotics or whatever. We try to manage our, you know, absenteeism, recruitment, engagement, summer plans, vacations. You know, our staff need vacation, they deserve it. Last summer, Intelligent Horizon put out public service advisories that almost stated, you know, our staff are burnt, they need their vacation. If you don't need to come to the ER, like please don't. Nobody wants to be at that point. So our advanced care paramedics, we've expanded that role. They only started a few years ago here in New Brunswick on law response vehicles. Now they're into the ambulance. So we have some primary care paramedics working on an advanced care paramedic. If they do it, you know, part-time, it's gonna take them like a year and a half. It could cost them $20,000. But at least they'll be recognized for it now and we want to help them. So this is part of the retention part, you know, to try to support our staff. We have community paramedic program and piloted in Miramichi where paramedics go see at-risk patients before there's an incident, and they develop a rapport with the patient and the family. And when they see things, you know, which would normally escalate into requiring, you know, an ambulance response to the hospital, our community paramedic can sort of, you know, help them along and navigate their journey and their medications. We've introduced an emergency medical technician, which is an ambulance attendant certification or classification that's lower than a paramedic. So the intent is to do low acuity transfers between hospitals and nursing homes. So the more emergency medical technicians we can have, the more paramedics are available for emergency calls. Yeah. Working on multi-patient transfer units. There's also a palliative care, this whole palliative care program. Some of our team went to the federal government and actually got money from the federal government for a pilot project, and it lasted 4 years, and it just ended. We're now in transitioning from pilot to operational phase. But in New Brunswick, something like 75 to 80% of patients that were seen by extramural that had a terminal illness, that were dying, that they knew they were dying, that wanted to die at home, almost 80% of them died in the hospital. Because the family needed support sometimes. So we've got some training for our paramedics and the extramural staff to support the families and you know, respect the wishes of these terminally ill folks. So that's some of the stuff that we're working on, and it prevents a hospitalization, better for the patient and it's better for the hospital system.
Is the new hospice providing any support for that?
They are, but I don't think they have a lot of folks in it that had like a half a dozen, I think,
They had, when I went to visit, I think they had 10 or 12 rooms.
okay,
Yeah, so they gave me the same stat that you just mentioned, and they were hoping that, because they had just opened, that
Yeah,
that
yeah.
would provide some relief to people who wanted, who didn't want to be in the hospital, but needed that extra care
Yeah.
in a different environment.
I'm not familiar with that, but I think there was a team in Miramichi, and there was a team in Moncton, and I think Extramural is working like on a provincial team,
Hmm.
you know, to get that available in other jurisdictions within the province.
Anyways, if you've never been there, it's incredibly impressive.
No, no.
Yeah.
Actually.
Yeah, it's kind of serenity, you know, it's.
Yeah, they do a great job, or a difficult job, that's for sure.
The difference between an advanced care paramedic and
Training and scope of practice. Primary care paramedic can administer 13 medications, and an advanced care paramedic could, depending on their protocol, I think, an advanced care paramedic can give up to like 80 medications. I think our current New Brunswick medication profile is around 20 for advanced care paramedics. Advanced care paramedics can, are defibrillators, like, if you need a pacemaker, primary care paramedics will put the cardiac monitor on, and they see that you need, you know, a pacemaker. Now, advanced care paramedics can do like external pacing. They can do the pacemaker until you get to the hospital, and then they insert one. So things like that. Next slide. The health plan. The province of New Brunswick had a health plan, lots of initiatives. A lot of it was under the former Minister Shepherd. It's being carried on now. Part of it is a primary care network. And then the emergency medical technician, I just spoke of that. The multi-patient vehicles, I alluded to that. And a special care home calibration, that's with extramural. But the primary care network, Medivy, our Medivy, you know, operating company has basically got a third leg in New Brunswick. We have EM, A, and B, extramural ambulance New Brunswick. Now there's our primary health care network. They're working with doctors, physicians, nurse practitioners, and they're trying to reduce the wait list for family physicians. And basically, instead of having a family physician or a nurse practitioner that, you know, has your, you know, has your file in their office, this system will have your file in the office. So they started in Moncton, Zone 1, Health Zone 1, and they got the list from Service New Brunswick, I believe, of people that were on the waiting list for family physician in the greater Moncton area. Provincially, I think it was around 60,000 orphan patients that didn't have a family physician. So what they do is they'll you know, call up this person, say, you know, we've got this the system that we can, you know, offer, and basically you'll have access to a physician and or nurse practitioner, thank you, NP, and your file will live within the system. So if a physician doesn't have time to commit to an extra patient, but they may have 4 hours a week, well, they log in to the system, there's a patient in the queue, you know, these are the systems, they'll call the, you know, symptoms, they'll call, maybe they'll order blood work, and close the file. Well, the next, you know, doctor or nurse practitioner, you know, the next day or 2 days later, they log in, the blood work has arrived, it's in that file. So they'll contact, so the person that does the follow-up could be a different person. So it's about capitalizing the little bit of time left within the system and, you know, clinics and stuff like that.
It's just distributing.
Yeah, so the initial list, I think, was around 56,000 or 60,000 orphan patients in New Brunswick. And after they got, you know, like 10,000 into the system, there are now like 80,000 orphan patients. So it's, the more they get registered, and some of them, when they do get you a family physician, you're now, off of the primary care network. But it's leading edge stuff, like other provinces are watching this very carefully, so it's allowing people to have access to care. Next slide. So our pre-alert that we started January of 2022, our pre-hospital, low risk triage. Last year, the number of calls that we had, like 911 calls, were 99,931. 44,000 were not transported, and of those, 15.74% were not transported because of the pre-alert. And so basically last year with this pre-alert, in 11 months, we kept, almost 45,000 people from going to the ER. Some of them had to call back, and we went back and we took them the second time. And that's where, I think there's work to be done to the alternative to going to the ER by ambulance. We need to have, more alternatives. But that's one of the strategies that we've implemented with the help of government and the Paramedic Association. Next slide. The EMT talked about that a little bit before. It's the emergency medical technician. It's a 9-week course. They can drive the ambulance. They can attend to patients. The tuition is probably a lot less than a paramedic tuition. So basically, it's a 2-month course. They started in the fall of 2022. Our first graduates are starting this week or next week. And it's inter-facility transfers. These are transfers that are pre-booked, pre-scheduled. We know where they're being picked up, where they're being dropped off, what language they speak, and about what care that they require. So our EMTs will complement the primary care paramedics so that they can respond to more emergent calls. Next slide. The accountability page. If you guys go on the internet and you go www.ambulanceproject.ca, we have a website. And if you poke around in there, there's an accountability tab, and you can see the response times, and you can select by region, by area. So if you want to see what the ambulance response times are in Salisbury, ambulanceproject.ca, and there's an accountability page. Those numbers are not Salisbury. I cut the bottom out just to give you an example of what the web page looks like. But you can see what the response times are in your area. Now, the areas are broken down. When Ambulance New Brunswick and the government negotiated the contract that got implemented in 2007, there are, there's the province, there's regions, and there's response areas, and the contract and the funding ties into response areas. So a lot of the response times and response areas were based on where ambulances were in 2007 when the contract was negotiated. And if we wanted to, move an ambulance station to a different place or something like that, it would affect a lot of stuff. So if you're looking for, Boundary Creek, you might not find it, but you'll find the area that. I think that's the last slide. Yeah.
So, from your paramedics perspective, it must be a very stressful job, obviously. So first of all, thank you for everything you guys do. There must be counseling programs are available to them as well.
We have, on our website, our paramedics have an employee portion of the website, and they have access to about 4 different programs. There's an employee and family assistance program. There's a critical incident peer support, and there's a provincial, under the Department of Health, there's a provincial mental health network. And we have paramedics that are trained on that team. So we have paramedic peer support. And, our employee and family assistance, it also includes families. But what we're noticing is paramedics are not really good at reaching out.
Right.
So for the last few years, we tried to do some training and awareness, to get peers to, let us know or get help or something like that. A few years ago, there was a long story, but there was this group called Tamaconter. Anyways, it was a Canadian, initiative, to help first responders. And, Ambulance New Brunswick supported Tamaconter and stuff like that. But what we're realizing now as well is sometimes we'll send out pamphlets or, fridge magnets. We're trying to get the information from the paramedic to their home.
Mhm.
So a family member can, maybe call and, it's confidential, like, as managers, we'll never know about it. But we're trying to get, paramedics to take the information home, because loved ones will see a change in behavior, and could be a symptom of something else.
Right, yeah, I brought it up only because a lot of the things you have on the slide are pretty powerful. Obviously, the patient 40 hours in,
Yeah,
and I've talked to some paramedics that have gone through that, and they're obviously all human beings, and
they've had patients die on their stretcher
right.
in the ER. You're in the hospital and you watch your patient die.
Yeah, that's what one individual had said to me, so
Yeah.
and I assume that you have the mechanism in place, but just, thank you for what you guys do. So,
You guys do a great job. Really appreciate it.
They really drew to light a lot of the numbers that you have, and I'm assuming that you have the same challenge with people getting older in your group too, so you must have people ready to retire, I know, right? But,
That's the part that we'll get to a point, we'll have more people retiring than we can hire, and that's been a problem in healthcare in general. I
Right,
believe that lots of people leaving for specific reasons, but retirement is definitely one of the biggest reasons
Yeah.
at the point. You can work 55, 60-year-old, but it's very challenging when you're young. It's demanding physically a lot. Older you get,
mhm.
there's no secret. You'll have a harder time to get to do the job. And we still have people working 60, 65-year-old and still working. They are passionate. They love the job, but there's a point your body tells you you just can't do it, right?
Right.
We see that more and more people stay older in the job, but there's a point that you need to retire and
Less effective.
absolutely, definitely.
But moving them to transport would be a great way to keep them going too, or whatever.
Yes,
the case is.
it's a good option, yeah, transfer system
And
or
that,
something, yeah.
again, part of the retention, some want to scale back and some want to scale up, so.
Mhm.
But to come to your question. In 2007, when it went from a lot of volunteer to paid, we were excited because, we were gonna make more money. But it also came with more expectations.
Sure.
More training, more expectations.
Professional.
Yeah. So some of the folks that were volunteer, I mean, my dad went to like grade 4 and he didn't pass, so they kicked him out eventually. He was like 16 years old. He was driving to school in grade 4, so.
The good old days.
Yeah, but the folks from that generation that were on an ambulance, that were volunteer, that were doing fundraising, it got very difficult for them to adapt but we lost, not a lot, but we lost some during the first few years of that transition. And back then, the government had bonuses for taking a paramedic course. If you worked for 2 years or whatever, you got some money back from your tuition. So around from 2007 to 2010, we saw some folks that were volunteer that, had another job that's, I don't want to do this full time. And we had some new people coming in. So we have a lot of people from that group. But a few years ago, 10 years now, the New Brunswick Health Council had statistics that said that, 5, 10 years ago, 50% of nurses in New Brunswick would be eligible for retirement within the next 10 years.
Sounds like now.
Yeah, but the government really didn't do anything about it.
Yeah.
Well, when the pandemic arrived and, people were dying and hospital staff were forced to work 24 hours. Some of these nurses that were eligible for retirement, that were still, yeah,
Sure.
So what can we do to help, get the word out, that there are opportunities, as a paramedic?
we could probably come to maybe a presentation at the school or something like that, or.
Or, that would be great. I think it'd be good to do those types of things, but do you have like sort of, short recruitment video or something that you could send to us? Because, that's something we could put on our Facebook site as an example. It's also something that we could send, I think of my son's been in cadets now for like 6 or 7 years. And those kids are pretty dedicated, and that would be a good group of kids to go to present something they may never have considered before. And it would be something that
Yeah,
we
that's
could
a good
send to
idea.
their leaders, because you've got lots of cadets all over the province. And,
They've got the discipline component.
yeah, and so, I mean, I'm just thinking that one group, there's lots of groups, obviously, but if there's something that we could do that at least would bring, to the attention
Yeah,
of some of these
sure,
kids. that'd be good.
Absolutely, no, that's a great point, and again, that's for sure, the younger generation
Right.
would be the one that.
And you gotta put it in their heads
Yeah,
early,
that's-
right?
and
Because
the sooner you can.
the sooner you can do it, the better.
And maybe
And-
that's taking place, I don't know, it's a very good point, I mean, I do know at the school, they do a lot of experiential learning, they bring in the students to UNB for nursing or different things like that, or the flight colleges.
No, that's a good point, and again, there's all kind of opportunities we can explore, right, but we need to pass the message to the right
Right,
people,
exactly.
and that's definitely by doing presentation, by being there, it's definitely something that can help us.
So it's a great career.
It's a great career.
No question.
Yeah.
And to further on Councilor Dottori's point, I was gonna actually ask this, just around, previous council, we've written letters to advocate for help for your group, obviously to the premier and health
Appreciate it,
minister.
for sure.
But that would be the thing I would ask you to take away around, from talking to, paramedics in our area, that they've obviously let us know some of the challenges, but,
Yeah.
by all means, what can we do to advocate on your behalf to, be part of a voice? Because again, yelling and screaming doesn't always help, but at the end of the day,
No, you're right.
but having a common voice just around, we recognize there's challenges, we have to collectively work together.
And sometimes just question of respectfully
Right.
and communicating properly, it's
Yeah.
changes the world, right?
Yeah,
It's, we need to,
Absolutely.
So as you
Even-
share this information with us, we've heard the different, the offloading issues,
Yeah.
the parts about rural, and I understand your service levels that you have to meet, but
Yeah.
there's sometimes an ambulance gets dispatched from here that goes somewhere,
absolutely, yeah.
and then leaves this area without coverage,
Yeah.
and we've all heard the horror stories around that. So,
No,
it's,
certainly, I'm from Sheboygan, I'm from a very small community too, and I always believe in communities, right? It's,
So, just as a transparency, we have
Yeah.
some great people locally. Anything we can do as a council to advocate or help would be certainly helpful. I've heard horror stories just around even, I don't know you mentioned the number of calls that you do and whether you're seeing increases, like I talked to firefighters, not just here, but in the city, just around the increase on overdoses that are taking place. And, that seems to be just going through the roof and spiking.
yeah. it's
So
also-
even societally, as we start to tackle social development challenges, which I'm sure drive a lot of your calls too. How can we advocate on that point to try to lower some of those calls too?
That's very appreciated.
Yeah, that one is significant, and I
Yeah.
think, the mental health of our entire population, we talk about it more, it's accepted, which is fine, it's agreed, but I think things have happened over the last X amount of years, that led to this, and, we seem to work on symptoms instead of, I had a presentation by the RCMP one time, a staff sergeant, saying that, I mean, not my place, but, when they legalized marijuana, the last thing to develop in a adolescent, from age 18 to 25 is your resiliency, your coping mechanism. Your prefrontal cortex develops and you've learned what you needed to learn now. Now you learn how to, cope with life. And regular marijuana use from the ages of 18 to 25 prevents that development. So now we know that legalizing marijuana will have the effect of 10 years from now, more mental health issues with, the people in the 30, 35 age range. We know that. The federal government knows that. They did it anyway. I'm not saying I'm for or against, but we should have measures in place to look after that, because we know it's coming. Kind of like the nurses and stuff like that.
Mhm.
Thank you again. That was
Thank
great.
you.
Thank you for the invite a lot, I appreciate it.
Yes.
I'll communicate with Austin, I'll let you kind of get used to the new kind of entities and stuff, and I would be more than happy to attend one of your meeting later, after a few months, we'll communicate with Austin and just sometimes just share numbers or just even to sit, just to see what's going on, I would be very interested of doing
And
that.
you're gonna get concerned from your citizens, you know, the
course,
things that
absolutely.
happen, you know, reach out. By all means.
So your role will be to come out and speak in the community as well, or is there other individuals?
Yeah, I would have no problem doing that for sure. If there's any need, I'm around. Again, I'm.
Well, but I think this has been very valuable for us, for sure. I do see huge opportunities just in even, we have a Horizon Health Action Committee that one of the biggest challenges I think that they've identified as a committee, and Austin is aware of this, is awareness of services and what's available and all of that, that potentially if they did know some of the services that were available, it might lessen your load
Absolutely.
potentially.
That's a key point right now. It's to have free hospital services,
Right.
and that's the network that's not developed as much as we would like, but it's gonna come with time. It takes a long time, and there's also the public education part. There's my grandmother, if she sees somebody, are you a doctor? No. Are you a doctor? No. They want to see a doctor. And
Yeah, that mentality has to change.
it will have to change, right?
No choice.
If there's people that seeing a doctor, well, it's not possible all the time in New Brunswick, unfortunately, and around the world. Just,
In rural New Brunswick, I mean, there's a lot of services in the cities. You get into rural.
yes,
You know, we have a great nurse practitioner here now that offers phenomenal
nurse
services.
practitioners, they do miracles.
But I was talking to a resident and they heard nurse practitioner, to your point,
Yeah,
and they don't totally understand all
Yeah.
of that. There's mental health opportunities for individuals that,
absolutely. But it's all question of education, right? More, put time in it, more
It's education, but it's also when you have the doctors controlling blood work and all these.
Yeah,
other
well,
things,
that's the
they
thing,
are
yeah.
the gatekeeper for all the services.
yeah, there's too much.
There's not enough of them.
Yeah.
It doesn't make sense.
Yeah.
Yeah, part of it is government, because, you know, look, at I have my 90-year-old mother-in-law that's been with us for the last year. She's been on certain medications for over 60 years.
Yeah.
But my wife has to go through hell to get those prescribed every single time, and sometimes they'll only prescribe it if she gets to a doctor. It's like,
Yeah, it's-
she's
Why?
90 and she's had these for 60 years, like some of the wasted time the doctors have just prescribing drugs it just doesn't make a lot of sense.
There's the barriers, right? Those barriers that in those days, we just can't have them. We try to have some system that can connect everything together.
Yeah.
Instead of having to pass word.
There's things that I don't fully understand, but about prescriptions, you know, if they've been on it a long time and you're pretty sure that they're going to remain on it a long time, give them a little bit longer prescription.
Well, sure, if you're a diabetic and you're,
Don't keep,
it's not going away
you know.
until they cure it. So to have to go through all that
But
every
sometimes-
time, it doesn't make sense.
Sometimes, you know, you only get a short prescription for whatever reason and
Yeah.
go back.
Well, Benoit and Ronnie, thank you very much on behalf of
Thank you
the
very
council,
much.
very our
Very
council.
appreciate it.
It's been very.
Careful, the big box of tomatoes over there.
Warmed up.
We didn't get any, we're looking at it, but.
I'm used to.
So, thank you very much.
Thank you,
With
guys.
that, next up, we have a presentation by Southeast District RCMP, Caledonia Region Department, Attachment, and Corporal Kevin Glode. Tough act to follow, but
Yes. Good evening. Hi, everyone.
Good evening.
So I'm Kevin Glone. I'm a corporal in Riverview. I'm doing the acting job for Tamara Patterson. She's a sergeant. Fortunately, we lost her in another position, so I'm it, I guess.
Not replace my wife yet.
No.
Can't believe that.
She used to be the ex
Yeah, many years ago, but.
years ago. I worked for her back in the days. And, so yeah, now I'm in a position for a couple, months already, and I don't expect Tamara to be back yet. Obviously, I'm learning a lot. It's a different job, Monday to Friday. Good for the family, good for the kids. My wife's happy. although I miss my team and I'm less on the road, right? I gotta do more, supervision on, we have 14, so that's my role now, and obviously first time here. I started in 2009, talking about me, I'm from Quebec City. I was posted here, Irish Town, my first posting, but I live in Petitcodiac. On Renfrew Street for, 2.5 years when I first started, 2009. So I know this area pretty well. I worked, the 5 years. After the event in 2014, I transferred to Moncton. I worked GED there for 1.5 years, and then I joined Street Crime, which is drug unit. I worked 3.5 years, close. And got my promotion 2.5 years ago back to Riverview, so back to where I started. And I live in town, so that's pretty much my background. I'm 38 now, and so basically I told Austin tonight, I came here just to introduce myself. I'm not prepared with any stats. I just wanted you to put the face on my name. And you know that I'm a open book also, like, anybody here you wanna reach out, I'll answer. Austin, reach out a couple times. Feel free, I'll try to answer any questions you may have.
I really appreciate you coming, just to,
Yeah.
putting a face on. And I know you, and I apologize if I asked some questions, I'm sure others will too, that you probably have already chatted with Austin about, but, previously we had a counselor that was working, with the detachment on starting a community watch program here in the community, which is, obviously something that, no different than anywhere in the province. There's obviously crime that's rising, and, you guys have a hard, you can't be everywhere.
No,
And in a Facebook, social media world,
camera in the face.
it's really hard, and you started a great program where people report things online,
Yeah.
which we really want to continue to socialize. But part of it is as a community, I think, is whether they call it community watch or whatever they call it. Best practices or how we can get something to establish just to, again, because there are concerns on whether it's copper wire theft or, you name it, things that happen that people always would like to be able to have a little bit of input. To
That's a
make
good
it
point,
safe.
because back in the days, I remember the neighborhood watch.
Yeah.
So again, we had, John Doe from Salisbury, calling our dispatch saying, I'm driving a red car, here's my number, call me, right? I don't know why this gone now, that was a good thing. Although in all those years, there's a lot of things that changed. One thing is that even us, sometimes we try to call our dispatch and we don't have like a backline. We addressed this issue multiple times, but we gotta go through the air.
Mhm.
Which I think it's stupid. We should have a backline saying, okay,
Yeah.
so on, I'd like to log in, but there's also good things that happen with us. We have the callback unit. Like sometimes we emphasize a lot of people and you have to tell the citizen to call us, because we have a unit that's called the callback unit. Those members work from home or work from the office. They can't wear the uniform, but it's all intelligence, right? So you get your shed broken into. I always give that example. Your ATV is gone, but police can't do anything because it's been 2 weeks, you're gone down south. Well, give us a call or do it online, report it, right? So we know. Lately, I'm just thinking I'm not gonna mention any names, but we arrested a young offender who confessed to us that he did like 17 break and enter and theft of cars. So we managed to link most of those files, and maybe 2 we were not able to link because we couldn't find who. So if you don't call, we don't know, right?
Right.
We also have analysts that look, theft of copper is a good example, right? It's always when there's a lot that we get involved. Well, we should get involved before that, but it's all work with intelligence and the power and who's paying at the end, it's all of us, right? So it's, now they get the new legislation, so people cannot go and just sell those copper for $10 anymore. There's more rules, but again, that comes back to public safety. But we have like partners and we have traffic sections, same with traffic. If there's anything on Main Street, at 3, there's always a car that goes through 100 and we're all busy. Well, let us know, right? I can reach out to traffic section and be Main Street, be there if you can, right? I'm not saying it will happen 100% of the time, but it's just if we don't know, we're not gonna act on it, right? And I'll be honest with you too, if you reach out and we're busy, well, we all understand that, but don't be shy, reach out, send an email, call us. Obviously right now, I'm not gonna mention any numbers, but we're short. As you know, they're short, we're short, everybody's short, and there's a lot of changes coming. With the RSMP, one of them is the body cam. Soon we're gonna have body cams. Well, guess what? I know, well, I know that disclosure is gonna be on us again. Well, no, there's supposed to be our people, but I know it's not gonna happen now. So it's just more duties to us that, you know, to do a court file, we spend a lot of times, in the office when the goal is for us to be on the road. I always said it, hire 1 or 2 civilian, do the paperwork, like our system is, that's what takes a lot of times, right? Good things we have, though, is e-ticketing, now we have e-ticketing in the vehicle, Pat collision, we used to write those, now it's all electronic, so there's good things coming. Obviously, body cam, I'm all for it. I said that's the best, right? But it's not there yet, but I know when it comes to disclosure, it's gonna be on us until they find a solution on who's gonna do it. That's, neither, I'm not gonna. But it's all things that, and the RSMP, we're a big machine, right? So it's not. It's all across Canada. It's not the body cam, the problem is the data. What do you put, where do you put it? How long you keep it? Policies. Hopefully we'll keep it for 2 years. Where? You need a big cloud for that. You look at other small, police force, well, you're 40, here's 40 body cam, and here's a big hard drive, and that's it. We're like 23,000 or whatever, I don't know how many. That's the issue. Money is always we all know, right?
Yeah.
Politics, in 2009 I started, now we're less member than 2009, well, it doesn't make sense, because population is growing, crime is increasing. I can't tell you why, right? It all comes back to here and to you guys telling the premier and.
Right, that's actually, you were here when we, so that would be the one thing, what can we do to help you? The other thing, just more of a question, I know you don't have data tonight, but the online reporting, system that was put in for individuals to report thefts, I think it's below 5,000, I can't remember the dollar.
I'm not sure exact.
Whatever the threshold
Yeah.
is, but just be curious in the future, has there been much uptake on that? Are people using it? Because one of the things we've noticed here is, and prior to that as well, is the whole Facebook world of, you'll be sitting there and you'll see people reporting about car break-ins in a neighborhood or somebody, and we saw somebody in our yard doing whatever, and then you'll ask, well, did you report it? Well, no. And there was like one time last year where there was this whole string of places that were reporting car thefts.
Yep.
One vehicle got broken into, or one vehicle got stolen. So we do know that the individual with the vehicle stolen obviously reported it. But then when we started chatting with all these other people, not one of them had reported it. So our whole thing was when we let Sergeant Patterson know of different things, but you guys do a really good job of, when you know that there's patterns. But as part of it is for us, how do we educate? So we posted it several times, but how do we constantly, like, we're gonna be doing a newsletter, Austin, to our community.
Yep.
Maybe it's we continue to have an ad in there, but like, how do we, like, I guess, socialize to make sure people are doing it? And maybe they are doing it, so I just don't know.
And that's the base of policing, and I emphasize that, like, you have to report it, even if we all know sometimes we can't do anything, not gonna lie. Sometimes I go, like, we talk about the vehicle getting broken, you get there, get a statement, and then you see the neighbor coming in, hey, come see me after, then you tell you have poor file, well, it doesn't matter, but we have to know that.
Yeah,
Right, poor
and
file.
I thought it was great when you guys did it, because I understand, because, people call and they get put on hold now, because it's a, short staff, so at least you've made it so that those excuses are not there anymore.
Yep, and sometimes don't be surprised too, that's why we have a callback unit, when it's not urgent, don't expect to get a call back right away. It's part of the job not to send it to a frontline member, same with online fraud or online. There's a lot going on, right? We all receive phone calls from an unknown number and then your Visa or your account's been on, it's all fraud, right, from other countries, but. Still have to report.
You guys have to triage what you can do.
Exactly, right, that's.
Can we
What
get
would you-
a link? I mean, I know I had it in
Yeah, I'll
my
send it
old
to the-
capacity as chairman.
The report to the.
To the report.
Yeah.
I don't know if I could swear that I could find it again, but if we at least maybe send a note to the,
And we posted, we posted, I think it's just one of those, it gets buried as new things come along.
yeah, just in
That's,
case a resident says,
It's really
this is what then we can go out and say, here, by the
Absolutely.
way, here's the link.
it's really
um,
important.
Yeah, I think so, and Crime Stoppers and other things, sometimes people don't like the police, they don't want to call, don't want to read their name. Well, they don't know that you don't have to leave your name. If you wanna call 911, don't provide your information, so you're right to.
And I know that they they enacted, legislation or law around the scrap metal yards happened to, and I'm not necessarily sure that they've appointed anybody with public safety to start checking on them or not.
That's a really good question. I don't have the answer for that.
But I'm not asking,
Yeah.
I've been told on the side that.
I'm
that's
hoping
something-
so. Most of them are in Moncton,
Yeah,
so, that's what I suspect they should train like a couple guys or girls just to be the pro, like be the expert
right.
regarding this. Now we know that they have to ask for ID and then take their names.
Mhm.
Do they all do it? You need someone to enforce it.
That's what I was at, and I don't, I wasn't expecting.
That would
answer
be a
from
good
you, but
question to ask,
I've on the
I
side
don't
asked.
know.
And it's just really around data, so it's
Yeah.
the data. And
Oh.
it's too early, it's probably too early to state whether or not,
And specifically with the scrapyards, I've heard anecdotally from some business people that they were required to write down the license plates of the vehicles coming in.
okay.
So the people doing so are not taking taxis.
Well, yeah,
I mean, the guy-
You get a guy who wants a fare on your taxi, bring in a whole bunch of copper with him and you don't say anything, right?
Copper and catalytic converter.
Yeah.
cars, Like those are.
that's, yeah.
You know, I know
always do
you're
what you
right.
can,
It's
Put
just-
things in place that hopefully we'll see a reduction in that.
But it's
because
good that, there's a new legislation, it all comes back to legislation.
Yeah.
It is,
I'm hoping the province will change, let's say, the motor vehicle act.
Yeah.
And same for,
and I'll give credit just on the record for Mayor Don Arnold and, in Moncton for really pushing a lot of that, because I
Yeah.
think I did really bad on that.
I mean, surveillance cameras in the scrapyards, is the only thing that makes sense. Put a face to
Yeah.
all of it.
and it's hard to pinpoint where they're from. So you get those people and they have pen and they tell you stories about where they get them.
Oh, yes.
There's no VIN on them, right? So it's hard for us to enforce possession or.
Stiffer penalties would be good too, at the end of the day. If, it's a risk and reward, even for criminals. Is it worth me getting,
Carrot and stick.
yeah, if I'm gonna
Yep.
pay for it big time, then maybe it's not worth me trying.
Is it the same, I guess you can't answer this, but is it the same groups that typically are doing the copper theft and?
Always the same people we deal with. Fortunately, and, reason is drugs also. Lots of drugs. like-
Go hand
Those-
in hand, I think.
That was kind of the other, we talked about that with the paramedics, but,
Need their drugs, so if they don't have money, they. Fine, right? Nope, like if you.
Penalty is not enough.
so
Drug
drug
fine.
use is getting worse in the greater Moncton area, or, I mean, I'm talking kind
Oh,
of
yeah.
region.
Working Moncton. Work and just came back from block training last week in Fredericton. I have to do this once every 2 years, and the CEO came to talk to us about possible changes and all that. It's all good and dandy, but the front line is where we need the
Yeah.
more people, right?
Absolutely.
And that's what we're complaining about all the time, put more member on the road, like, I'm not a fan of doing Tamara's job and now they steal Tamara from us and I want Tamara back, right? So it's all, it's a fight that never ends.
Mhm.
It's unfortunate, but that's the reality, so we have to deal with what we have. And without saying numbers, that would be a officer safety reason, but when I say we're short,
Are they looking at recruitment, like changes or promoting it? Like, I know I have friends that are RCMP officers and it just seemed like a very, I know it's a big job. The process itself scares people, right? To become one and to have to leave your families and then be stationed wherever and,
Yeah.
but maybe bringing people home to do it could be part of the
Yeah.
solution, right?
that's one thing when you join that they can't guarantee you'll be back in Salisbury.
Right.
In New Brunswick. I was just from Quebec City, lucky to be east, could have gone
Mhm.
west. There's no guarantee, that's the scary part, unfortunately.
Yeah.
Yep. 100%.
Thank you
It's
for your
similar to the
service.
doctors though
Sure.
too, it's taking away some of the jobs that you shouldn't really be doing anyways.
And that's why the medics, we all try to work together, and let's say we have a mental health call, sometimes we have to go. Our last resort would be to detain on their mental health act. Have to, we'll do it, but once we do, arrest people and detain, we have to bring them to the hospital, and guess who's responsible?
You.
It's us. Until they're seen by a doctor. Some places are good, some places are, depends who's the doctor, some will. But once we have a member with that person at the hospital for 2, 3 hours, they're not on the road, right? So trying to find a solution with now public safety, getting more involved and trying to find common ground, say, okay, or even guards, but it all comes back to the Mental Health Act, or like, it's all legislation. The public safety is getting bigger. That's how it works when you pay police services. Well, we all know it doesn't all go to us. It goes to province, and the province decides where that money goes, right? I think we do an awesome job with what we have. That's me looking up from above. I see FOB, and I'm like, wow, that's awesome. Like, results are there. We have good members. It's just, heard you saying about mental health and all that. It's tough for us also, right? So you burn your best, like try to bring more people. Like I wish I'd be more proactive. Like we all wish to be around and do roadblocks and stuff like that, but sometimes we can't, we're too busy. But we have a traffic section that their mandate only is to give ticket. You'll see that it says traffic on their vehicle. May not get a chance from them, but you know, that's their job. Right?
But I think the speed cameras do make more sense for some of those type jobs too.
The what, sorry?
Speed cameras?
You mean in the
Radar
vehicle?
cameras? No, dedicated cameras for speeding,
Yeah,
just to take those jobs away from members.
Yeah.
Move them to better positions,
Free up the time.
you mean
automate.
like on the highway and stuff like that?
wherever.
Yeah, I
City,
mean, in
highway.
Quebec City where I'm from now, they have they send you a ticket.
Yeah.
Yeah.
Europe's been that way. I got a ticket in 2015 in
You should see the,
Amsterdam.
I read an article a couple of months ago about the money that generates.
Oh.
Millions.
Big revenue generator.
Million. Camera costs nothing. I'm not saying that's the way to go. We're far from there.
It'd be nice to free up your time for,
That would generate,
Revenue.
when they tried doing it in Ontario,
There's
boy, I'll
fine
tell
thing,
you,
there's a-
it's screaming
The
like
radar,
crazy.
if you get caught, it's because you're moving too fast,
Yeah.
right? There's. But yeah, careful when you go to Quebec City.
and I know you don't have the data, and this is okay. We've had this conversation in previous councils just around bylaws that sometimes rural communities have, but the expectation is that we would call on the RCMP to help enforce them, and the reality is you guys are very busy on a lot of different things, so as we start to look at bylaws in our community, that's something we should probably consult with you on.
Yeah,
as well.
sure. It's always good to have a strict bylaw, I think. Other places, you're on top of things with the community, you know who's coming, you know who's leaving. With a place like Shediac now, they have to deal with the people they want to kick out. But
Yes.
sorry, once they're there, right? So
Yep.
look at bylaws and know who's buying what and,
Better to be proactive.
exactly. So, but like I said, anything at all. Pretty much an open book. I know we talked about, possible detachment. I don't have the answer. Can't confirm anything. It's accessible, but hoping
So are we.
that we're all on the same page. We just need more police officers, not gonna lie. We always, like I found at Caledonia, we're always kind of left alone because, oh, you're just outside Kodiak. Kodiak's not gonna assist us unless there's a shooting or something major, but when I first started, we used to have a GIS unit. Now they put those positions, but it's all the big, you know, southeast, northeast, when they created the territory, so hoping it's gonna change, we just need more.
Where's the detachment now? Like physically located?
Basically,
Yeah.
Review over.
on Pineland
Oh,
Road.
then.
Pineland.
Okay, I've been there, I don't know how many times, and there's nobody there.
Beautiful. Well,
There's nobody there?
there's a reception
Oh,
area right
there's the
there.
reception, it's open, like, the lady in front, she'll do most, it's Colonel Check.
She's great. I've been there 3 times in the last month, and then I ran into her in Miramichi snowmobile.
So it's still there, okay.
Yeah.
We did a police check, and I don't know how many times I went to pick it up, and It was it
Yeah,
was,
there's our on the website there, and she's busy too. She's.
oh, I'm sure she is, yeah.
She'll give you, if you go today, she'll come back and next week to get it. She can do it on the spot.
Yeah.
But, that's how, like, I wish I would know how to do it. Sometimes we help people, but I don't, so that's her job. But, we have a TRT, which is a telephone unit respond, also at a detachment, two girls there. They answer the phone for most of the calls, they send emails. And then we have our member with the police car, and we don't have cells there because we bring our prisoners to Moncton. So it's getting old. And, it's like this, Salisbury detachment there at night. Those satellite detachment, they were awesome. Betty Kodiak, do your stuff, she do it here. I remember just being here. Well, if you get a call, you're close, right?
Mhm.
Not gonna lie to you guys, I think you're the most lucky of the group because most of us are always like in Salisbury, it's more like in the center. If you're in Petty Kodiak, then you get a call in Versailles, Albert, pretty far, right? So now without those satellite detachment, yes, we can work in the vehicle, but to do the small things, whenever you need to type report, you need to go at the office, right? So we do spend a lot of time to find ways to, okay, how can we do our job that's more efficient without the member being that busy? That's our simple problem, it's not you guys, right? It's our job. And that's what we're trying to explain to the big boss and like in Kodiak, they have different section, right? They have a lot of support, so a lot more busy. But, you get a robbery, or you have GIS, it's gonna show up. Will the member go back on the road the next day? Us, we have something big, we will investigate it for the next 4 nights, 4 days, right? We may pass it on to the next group, so we don't have those investigator. It's good to learn when you start, but more support would be awesome too. I think you guys are all just really complaining about reality. of it all. Exactly.
No, you're
reality.
stating facts. You're stating
Exactly,
facts.
that's all. But is there any question? Like I said, I'm pretty open. Reach out. Ask for Kevin, call you back. Monday to Friday. Send me an email. Text me.
Yeah, Corporal, thank you for all that you guys do. We really
You're welcome.
appreciate it.
I'll come back in 3-4 months from now, let me know Austin, like, with them. I don't mind. I'm not gonna come every month, but if there's anything in the meantime, send me a question. If I don't have the answer, I'll get it. Last tomorrow, I'll ask the big boss or inspector. No problem. I'm a rich word. If I don't like what I'm saying, but if you like, whatever. If you like me, you don't.
Honesty is much better anyway.
Yeah. Oh, that's it. Thank you for having me.
Thank you.
Thanks for coming.
Thank you.
Thank
We
you for
appreciate it.
supporting us.
I also live on 2009,
Oh, what address?
the one by on the corner.
So you know where's my house? Oh, 50.
You look familiar.
Never
There's
wrong.
always a police car in the driveway. You know, it's all.
This is being recorded, just.
That's all good, yeah. I don't live
Like
very
already-
far. yeah.
Okay, good, okay, good.
No, they sold the house, right? And they moved the satellite detachment.
Yes.
Those are, there's simply housing in Hillsborough also.
Yep.
And Petty Kodiak, so they simply decided to sell. It's great for me to start.
Yeah.
Petty, his car there. Sometimes on my day off, people were coming and knocking at the house. I was learning a lot. Now I'm in town, I'm gonna say my address. Got my phone number. Right, thank you.
Thank you.
Thank you.
Take care. See
I'd like to
Bye.
have a recess.
That was-
Motion.
Yeah.
We have a,
Thank you.
thank you. We have a motion for recess by Councillor Thorne. Do we have a seconded by Councillor Colwell?
That's unanimously.
Aye.
Aye. All in favor? Aye. Contrary? And could I have a motion to return back to the meeting? So moved by Councillor Tory, seconded by Councillor Gallant. All in favor? Contrary minded? Motion carried. Now back into the regular meeting. Let's move on to Salisbury baseball field damage.
I believe so, maybe.
Did you give Diane your
I
form?
did.
Okay.
Yep.
Is the baseball field damage,
It's just, yeah.
it's
Just being safe.
Just, she's, yeah, she's just. Okay, so as noted in the CRF, I'll try to make this one relatively quickly. I'll start it with the fact that we're looking for direction on this one. We have some informal estimates, I would call them at this point, because they were visual. But as council knows, in mid-January, we experienced another instance of theft at the ball fields, to the tune of about $10,000 with tax inclusive. And so this year we had budgeted about $6,000 for repairs to the backstop that were made, brought to our attention, I should say, by Baseball New Brunswick or an umpire. I'm not sure what they would necessarily represent, but so that was budgeted this year to make some of those repairs because it was a safety concern. Now we're in an instance where we have an additional expense of about $10,000, give or take. It could very well be more by the time they get up there, but that's the estimate that we have now that was sought for the purposes of the investigation that's ongoing with the RCMP. As of January 1st, a deductible for our insurance is $10,000. So we're at a point where, from a risk perspective, there's more risk to proceed with insurance and have a likelihood of increased premiums, just to basically pay essentially the same amount of money as we would to repair it. So with that, before we move any further, we have the estimate, like I said, for the purposes of the investigation, but we're at a point now where if we want lights for the baseball season, essentially, we need to find that $10,000 elsewhere. So we're looking for direction to determine whether or not that's what we should be doing, or if we should be trying to push the backstop repairs and do the lights and see where we end up at the end, a combo, pursue insurance, which again, we would not recommend. But there's a number of alternatives there. So with that, the recommendation is that council direct staff to proceed with both sets of repairs, and come back at a certain point, because it's an unbudgeted item, so it will, unless it's under $5,000, be beyond our authority. So we will come back with that formal quote or expense. But for now, we're looking for direction as to whether or not we proceed with both repairs or not. So with that motion, and then on the question.
Can I have some questions?
We need a
Oh,
motion.
motion first, okay.
I'll move that council direct administration and staff to proceed with repairs of electrical wiring and backstop at the Salisbury ball fields, including finding budget from other budget lines as needed.
Seconded.
Moved by Councillor Venus. Seconded by Councillor Stephanie Thorne. All in favor?
No, we need to have.
Question.
I have some
Sorry,
questions.
sorry,
yeah.
apologies.
So a couple things. First and foremost, and I think that we should be looking at any potential restitution opportunities that might be available from whoever it is that was the offender. So I hope that we are pursuing that. The other thing too is two questions. First of all, does anybody have a good sense of what the so-called danger issue with the backstop? Like, I'm trying to imagine backstops from my previous lives in baseball and what the real issue was there. Is it a real need, or is it just a nice to have compared to the lights? And the other question I had about the lights is, how many night games do we have? And is it, if someone said, well, you're not gonna have lights, seeing as how during the summer, it's gonna be, how many hours during a night game do you really need? Is it possible to push the time the games are started? And I think just those types of questions to sort of get our,
Have data.
to have some data, because at the end of the day, maybe we do fix the lights, but maybe we do it next year if we have it in the budget, as opposed to it not being in the budget. Just a couple of answers to satisfy myself that
We may have the answers on the.
Last year it was an issue that there were no lights, because we had the same issue last year with waiting and waiting and waiting for MB Power to get it hooked up. And I know that they use it pretty much every
Because they
night.
they practice on
Yeah.
top of the games, and it's from a timing perspective, but it would be good even for the future. Unfortunately, this doesn't seem to be going away.
No,
That we do have data around, because I mean, it is different in the different times of the year, because it gets darker earlier in certain periods. But it would be good to have that, but from what they indicated last year, Joe, it would be still good to quantify that. but they do use the ball field every night after hours for
Yeah,
practice.
I mean, I'm just not familiar with,
Yeah.
you know, how many teams there are, how many games a night that are being played.
There's over 200 kids in the association.
Yeah.
There's a good fair number. I know, I can't remember exactly, like this happened around this time, I think,
Yeah.
March last year. By the time, because of the insurance, like that went through insurance. It was the shed and a number of different things that you guys could speak to better than I, but by the time it was hooked up in August, the association, because that's the primary user of the field, was very eager to have lights on because they were delaying and canceling games. That's why we are coming now for direction, because we don't want to be in that same position where it's mid-August when it's dark
Yeah.
early,
So that
so
would be what is the,
we can check on those numbers for sure.
Yeah, I think we just need to,
we should
I
have.
don't have any major objections to it. I just feel, I would feel more comfortable knowing what the
Right.
actual situation
We
is.
should know it anyway, even from, I've heard from different groups, adult groups who talked about potentially starting co-ed softball or just doing those type of things, and I don't even know if we have any vacancy that we could even accommodate that. I'll be honest, we might, but it would be good to know that regardless if somebody was to come forward on that.
I'd argue
I
pick
think-
one.
Hmm?
I'd argue pick one, backstop or the lights.
And the backstop to that question is specifically, it was raised, I wouldn't have the specifics, Trevor, I'm not sure if you might, but it was raised to Jarrett from the Empire, and it was specifically stated as a safety concern, so it is in
Yeah, that's
disrepair.
basically what came down
Yeah.
to, and if you took a visual of it, it looks a little shaky and unsafe. Unfortunately, we don't have photos of it right now, but,
I've never seen it, so I don't even, I can't even.
Oh, so it's not, it's,
Would it be possible?
down
to
at
ask
the
the
bottom, it's
association
all
to come?
curled up and
Okay.
have explained it really,
Yeah.
real well. It'd be better if we had photos of it, but, it apparently was brought to Jared's attention.
And that
Coming
was
apart.
last year,
It's coming apart.
Yes, it's not in great shape.
it was also used as for another theft that we had down there, a piece of the fence was easily removed for the purpose of breaking into another shed, so.
So for my,
it's in-
so what I would like to suggest is that, we can have the vote, I don't have any objections to it, but it should be contingent on us getting information
Yeah.
so that we can really take a look at it and, trust but validate, you know? If they say they really need it and they need the lights, okay, fine, now show us your schedule. Right? And show us how many teams are playing every night
Mhm.
and what times they're playing and get a sense of when it starts getting dark so that we can, because we're responsible for this money, right? We can say, yeah, there's no way that the league cannot function without lights or that kind of thing. I'd feel a lot better. I've been involved in lots of baseball associations in the past. I know it's different now than it is there, and they didn't necessarily have lights.
Mhm.
And there were a hell of a lot more kids in Mississauga and Brampton and Toronto than there are in Salisbury, so.
so I have more of, I guess it is a question. And probably the electricals, we did get a grant last year to help with some of that work. Would there be, through the same grant, would there be potentially, money that could go for the backstop that we could look at? I do know that fund is gonna be available in April
Yeah.
again, so.
That's that one is an annual one that does have a certain cap for
Yeah.
geography. It's unlikely
Okay.
to get more than
That's what I'm wondering.
more than 1-2 years in a row, but it doesn't mean we can't try to chase.
That's fair. I just, and that, if there's even any coin G or.
Too specific for that. So
What's
we're at the
I
max
know,
for point G,
yeah,
but
so that's
yeah.
good. You're doing a good job.
we're at the max.
To me, we pay for one, and if they want the other thing this year, then they can help pay for the other.
Or do we do a fundraiser?
Whatever the case is, the association, yeah.
Yeah, it would stand to
Or-
reason to me that if we were gonna do it, we could do the lights. Or, yeah,
Or have-
one or the other.
Have them increase their
Well,
their
have we
fees
talked
to
about
pay
this?
for it over a couple of years, or whatever the case is, but
I think I would love to see, and it's gonna take us time, but operating baseball, what it's. Again, what I'm saying is, are we even budgeting enough, each year? Because incrementally, it seems that if our insurance deductible is 10,000, it seems like we are getting these type of thefts regardless of scrap metal yards and everything else. It seems to be, we would have to budget that annually just for, unfortunately, for those occurrences, and then whatever else is. No different as we start to look at other infrastructure. What other, like, I'll be honest, like, so for instance, those poles, like what's the life cycle on those? What's the life cycle on the side fencing? I just don't know around.
I think we're beyond scope of these two though.
Yeah.
I guess my thoughts, sorry, Jason.
Go ahead.
I don't wanna do anything that's gonna limit the use of those fields.
Yeah.
They're very, very busy, they're used every
They
night,
bring in a lot of,
they bring in a lot of people. Grand scheme of things, I don't think $10,000 is a huge amount.
Have you looked through the budget? Like, is there room?
There's
I
some
know
pieces
budget
here, we
transfers
can,
are coming, but
Yeah,
like, could you
it's-
find?
there are some options, it's a sake of, the reality is just when you take 10,000 from one place, there's
Yeah.
10,000 less somewhere
Yeah.
else. There are items where if, let's say council comes today and we proceed with the budget transfers that we have, that's obviously not one of them. There are spots at the end of the year where we are hoping to earmark for reserves, for
Mhm.
instance, that was a number that was determined by the facilitator, so there's some flexibility places like that, because generally, by the end of the year, there's some expenses
Yeah.
that aren't full, right? So it may offset there, but it's just unfortunate that it's in February and January that all these
Yeah.
things are happening.
Well, this is-
Every year.
Yeah, every year.
And I just have one other point, depending on the backstop, if it is a safety issue, which again, we've not validated, but if it is, we have to do that.
I'm not an expert, but I would deem it unsafe myself.
If that's the case, then
Yeah.
I would have to
Oh,
think that that
yeah.
needs to be done.
So I would say priority on the backstop for sure. My question is, at what point, like, how long can we delay the decision on the lights before we are impacting the season? Because last year, like this happened around this time and
Yeah.
we impacted the season for a whole bunch of other reasons, but are we gonna run into the same problem with getting somebody to,
Was it?
Run the
was it
wires.
control- Was it controllers last year, or was it the?
It was a
actual
little bit
wire?
of everything.
Yes,
Yeah.
a little bit of everything.
Yeah.
Yeah.
From a contractor perspective, I'm not sure.
Contractor, then NB Power.
With this time around, do you think, did they give any indication when they visited?
They're very busy, but I would say they would need a month lead time, probably at least, I'm guessing.
so
It
if,
becomes more a problem in July, I would imagine,
Yeah.
as the.
so if we defer for a couple months on the lights, then we're not at risk of putting the,
Yeah, I don't know if I would defer for a couple months.
My question would be, what are we deferring, hoping to find out?
Yeah,
yeah.
Can you,
They can't get in there till probably mid-May, I'm guessing,
Yeah.
depending on how wet the ground is.
Yeah.
And
Early
do
May.
they, Stephanie may know
to-
if you do.
I don't fix it.
Also, like the end of June.
Oh, I don't.
You don't wanna
know.
plow
Yeah, they start the,
Yeah.
You don't wanna plow it over
No.
the high school will have a
It's
team
quite
too.
soft
if they
down
need to.
there too.
Be hard right now.
I don't know if they do,
Yeah.
I don't know if they do night baseball, which I have no idea.
I doubt the school would do night baseball.
I always
So-
thought that night baseball was at the end of June.
we can basically, we can look at some of this information and come back. Ultimately, with the committee of the whole and regular council model is that there's no, like, we won't be able to Councillor Thorne's question, like deferring for what? So we won't be able to move forward with an expense over 5,000 where it's unbudgeted without a council motion at a regular council meeting. So if we're deferring, for instance, and we come back at committee of the whole in March, when the earliest we'll get is mid-April, if we defer till April.
We've already deemed that the backstop's not safe. It's a matter of finding money within the budget.
I think that.
well, the backstop was budgeted.
Yes.
Yeah, backstop's price, but it's 10,000 for the electrical, so
Yeah.
it's a matter of finding that, or approximately.
Should that be
or
broken
scaling
into
down.
motions? Like, we're not putting a motion to,
All you're doing is directing us to do both or not directing to,
And it's directing us to do both at a future council meeting, right?
we need to come back for unless, let's say, for instance, the electrical comes back at $4,999.99.
Then they can move
It
forward.
won't, but let's say it will. I can go and find the budget elsewhere based on our
I would
financial
say
management policy.
if you can work with the association to get the number of night games they would expect to play for our March council meeting, we should probably use that to justify moving forward. I'm okay with moving forward without the numbers, but
Same.
Yeah, I don't have a problem moving forward with them. I just would like for us to have, I think this goes back to a conversation we had in a previous council meeting where we were talking about some of the work
Yeah.
that your guys do.
Mhm.
And, I think maybe there needs to be a broader discussion with the association as a partnership moving forward as to what you're gonna do, what you're gonna pay for, what we're gonna do, what we're gonna
Yeah, I
pay
think
for.
just knowing the data regardless
Yeah.
of how our youth are, I mean, it's a great opportunity, I think, to Councilor Venus's point, 200 people playing baseball.
I didn't say that.
Okay. so-
That was me, that was me, yeah, that was me. That's the latest.
I'm making, I'm sort of giving you credit, but it sounds great, but.
But at the same point, we can eventually get to a stadium too, like, what are we trying to accomplish?
Well, I think,
And
we can pragmatically talk
I
about.
don't think the stadium is where we're
Yeah.
going.
No, but-
$50,000
but
last
year.
200 individuals, if they're playing, if they are, again, the data is paramount. But if those parents are picking up kids, and the chances are they're probably going to grab groceries or doing something when they're doing it.
Like I said, I'm good with the motion that was presented. I just would feel more
I
comfortable
think you need.
having information.
And so with, just so I don't bring this back to a committee of the whole meeting again and not be able to make a motion,
Pass.
I'm not confident that we'll have the numbers and information for the March meeting or the regular council meeting, so it'll probably be the April council meeting, so the April 11th, it's that Tuesday, because that's Easter weekend, but that's what we'll aim for, and the intent will be to come to a regular meeting where we can have a motion and.
Sounds
do that,
Like with,
because it'll be
like with quotes and.
Got it.
Got it.
Lovely.
on the motion.
Can I ask you a question?
Yeah.
Sorry.
Sorry, there's no, like, I can't put a hand up here. Has not having lights attributed to the theft? And are the lights dusk to dawn, or do we manage putting them on and off as required?
We put them on, the day that that was the situation, right, where the power was out that morning, yeah, so the day that this particular theft happened, where they got literally the wire span, was done when there was no power in the village, from a storm, like from the weather, so it was, a window of opportunity, I would say, for this one. And that's this situation, but I don't think there's any dusk to dawn down there. I think they're all manual, is that
Yeah,
right?
it's not lit and,
So if it's lit, it's only lit because we light it. It's not lit as a, like, safety precaution, like having dusk to dawn to prevent people from going down there.
I don't think there is.
It's.
I think
might be one on the.
Feel there's.
On the building,
There's
yeah,
one on the building.
Dust to dawn.
That's, yeah.
okay, on the tall building,
Either that.
not
or-
enough to light up the area
No,
where
no,
they're getting
either that
wire.
or-
No, it just
or
kind of does
towards-
the backstop
Yeah.
area.
Yeah.
Yeah, not enough to where they're getting
No, no.
this, so to that question, no, we're not lighting up enough to prevent theft, I would say. The only preventative measure I would say are the cameras that were installed that was all last year, right? Yeah. Last year following that instance of theft,
We had cameras that caught this particular
Yeah.
individual, right?
right? Yeah, that's potential like an alleged suspect, yeah.
Okay.
Motion?
Motion,
Need the question, we said the vote,
Yeah.
Yeah.
I already made the motion.
all in favor?
Aye.
If reminded. Motion carried, culvert and driveway entrance.
Bring-
Yeah, oh, yes, yeah,
There.
Counselor Caldwell for.
Go ahead.
Can we just yell at her?
The walls are pretty thin.
Exactly.
Okay. Moving on to the next item, I will defer to any technical questions to Trevor on this one, but bear with me as I try to give a bit of context. So in essence, essentially annually, the fees for culvert installations are reviewed. This would apply only to the former village, so Ward 3. In the outside areas, this continues to be done by MBDTI through the special provincial levy as one of their services. In 2022, the former council raised, I should say, my apologies, the fee for culvert installations by about 25% in light of rising costs. What we're looking for direction today is to do the same thing again in 2023. So from a process perspective, the reason why we're bringing this to committee of the whole is for a couple of reasons. One, to get direction on that element in particular, cost of new installation, and also two, to introduce the bylaw specifically. So as opposed to doing an amendment to a bylaw that technically this council does not have any legal authority over, we'll go through the process of introducing it for first, second, and third reading as a brand new bylaw. Although it is essentially the exact same as the one from the former village, with the addition of one element, one clause that essentially has a stipulation where there's a maximum amount of frontage of a property that can be a culvert, essentially. So that's the main kind of addition or amendment to the bylaw, other than obviously the standard formatting that we're seeing in all of our upcoming bylaws, changing village to town, changing provincial legislation, so on and so forth. That is essentially it. There is one element there in the CRF that that outlines essentially the cost of culverts if new culvert, so it does not, and the intent isn't, but it does not cover the cost, this fee of the new installation. The costs vary quite significantly. So with that, that's a bit of the intro, and pending council direction, the intent would be to bring this forth to the March council meeting for the introduction of the bylaw in order to have the fees finalized, approved accordingly for the start of the installation season, which can happen starting in May. So in order to meet the schedule that we need to meet, that's the reason we're coming here now.
You're looking for two motions here?
No, oh yes, sorry, because we are separating them. So fees, if we have to have a separate discussion around fees, and then to bring the bylaw for actual introduction and consideration in public.
I'll move that council adopt the 2023 proposed rates for ratification at an upcoming regular council meeting.
So moved by Councillor Glenn, seconded by Councillor Thorne.
I do have a question. The main thing that stuck out to me as I was reading this is how annoying that we have to keep coming back and raising fees every year. Can this schedule be eliminated by just saying you will be charged 40% of the cost for this installation? Or do you need to have the fee out there so that developers can see what it's gonna cost and budget for it? Like, how does that process work?
I think the challenge, this is where I may defer to Trevor, but let's see, is the unlikelihood of having a standard fee for this. So if a new culvert is being installed, it may involve ditching. The cost of a culvert can fluctuate from May to October. And so this is a standard set fee for the resident. It could cover 60% of one culvert, it could cover 70, it could cover 40 for the next. Like it will fluctuate, so it's a standard fee. I'm not sure historically how often it's been updated, but I would say probably not 25% annually, like it has been. It's just that's the reality. Yeah, because even now it's in here. I want to say it's about 40% of the cost on average based on what we did last year.
And so I was wondering, is that what we want to get? Like, do we want to say whatever our total bill is at the end, we're gonna charge you 40% and done, and we don't have to update the schedule?
It's less predictable that way, and because essentially these are new culvert installations, so hypothetically new properties for the most part, like that's generally what they are. So it's nice to have those things standard. Normally, we won't have to go through the full process of updating the full first, second, third reading. We won't do that because the bylaw will be finalized. It'll just be the schedule. So it'll be one motion at council when needed. So there could be next
every year you're looking at those fees.
If the fees continue to increase, like if
things get cheaper every year.
Yeah, I wish. I wish.
And we may want to charge more than 40% at some point if we have
I
to.
just wondered if it'd be easier for us to say, we want to recoup 60% of our 40% or 60% or whatever every time, and then we never have to look at this again.
When it first started, it wasn't a 40% thing. It was trying to cover the entire cost.
Oh, okay.
100%.
Making sure that the culverts were put in the correct way.
Which is what we're trying to do now.
Make sure they're installed correctly, yeah.
Why don't we do away with it altogether and say the resident will be charged the cost of the culvert installation?
Or the first one.
For all of
It
them.
have to be invoiced back. As it stands now, the resident comes in, fills out a form, pays the set fee.
Prior to you doing
Prior
the work.
to the installation.
Yeah, that's the chasing
That's
piece
now-
will also maybe a bit of a headache just based
No,
on.
I see it now. I just didn't,
So what's the benefit of doing the way we're doing now instead of just invoicing the whole price
the
after the
upfront.
fact?
I would say Yeah.
You could do a quote ahead of time and make them pay for it.
It's gonna depend because of the nature of the fact that sometimes there could be ditching, and maybe there's no ditching and it's culvert done, and those are the ones.
It's a different situation. You could have to ditch downstream several meters.
You've seen the price fluctuate.
Or you might not have to do any ditching at all.
Now that I know the process, this
Yeah.
makes more sense. You're making people pay upfront, so you need to have a set price because you won't know how much it costs. You're hoping to get the full amount, but that rarely happens.
Those details up front though, we don't look at the property and.
Well, things can happen.
Generally it depends
We have
because
to
of
contract it out as well, don't forget. It's not us doing it physically. We have to contract it. So we're at the whim of having a contractor available to do this work. So if today this contractor can do it, but this one can't, or this one's too busy, then we move to the next one. His costs might be different than his costs.
So why not double the price and then rebate them?
Do you mean,
Say that again?
Increase
Yeah.
our fees to the point where we're
100%.
recovering
Right.
most of the cost in most cases.
Right.
And then if there
And then
is
if you're
additional, whether the
Yeah, it's easier to give somebody money back. than just-
additions?
Yeah.
Agreed.
it just seems,
I guess it would be a council decision as to whether or not the intent is to secure 100% or to.
I guess that is the
to
question,
collect.
yeah. I
that's
assumed
fair.
from reading this, we only cared about getting 40% back.
That's because historically the costs have. gone up.
Right. And we just didn't adjust.
Correct.
I
So
don't see why we're
what is our
subsidizing
intention?
someone's culvert,
And once the person
especially
has the
developers,
one culvert,
if it's a development.
if they're new, they're developers.
Cause
And-
the whole community's paying for their culvert.
Right, we're subsidizing the culvert of this.
once you have your culvert too, the village is then responsible for that culvert.
Oh,
So that's
it's
why
better.
we did the bylaw to make
True.
sure that it was done
Standardization,
correctly.
standardization.
That is
Right.
true too.
I 100% agree, it needs to be
Majorly, yeah.
done correctly, but I don't know that all residents need to be subsidizing everybody's
And
culvert.
the other thing is if your culvert costs $10,000 and my culvert costs 6,000, it's not fair to charge us the same amount.
Right, because you might be
Cause
paying.
my property might
60%.
be simpler and there's something that
Well,
complicates it.
it's not so much in fairness, you're just not paying for what you're getting. You're paying more, cause I assume
Right.
that split would be 8,000 for both of us. So
Right.
you're subsidizing the more expensive
Yeah.
stuff.
Yeah,
Yeah.
so,
It makes no sense.
so your point's well taken, John, like, so.
I would
we
say
can do
then,
that.
because I think one thing that we would come back with too, is around the former LSD outside areas, which are, I think, cheaper than
Left
our
alone?
current
Yeah.
rates.
Right.
Yeah,
It's much cheaper.
but longer, takes
But
longer.
long wait with
Yeah.
DTI, and a lot of times people just hire their own contractors, slap it.
Say this again about DTI doing culverts in the
I
road.
was gonna, I was stunned by what you just said. No one in Ward 4 has seen anyone dealing with a culvert from DTI in the 14
Yes,
years
they
I've lived there.
do, but they don't do private.
They don't do
driveways.
private, they would
They
do it
do-
along Coverdale Road or someplace
And
like that.
waterways that are draining underneath the road, but they're not doing,
Cause we've seen,
Private driveway.
we had people out there with tractors trying to deal with the flooding that's going
I
on
might be one of
in their culverts.
So then is the direction, then do you
So-
want us to look at because we need to have rates finalized by May 1st. So either
Sure.
we update the bylaw and it gets amended, approved and done by May 1st, or we go on last year's rates and it's even less than the 40%. So we can bring it back, or I need to make sure that we have a discussion internally to see what does that look like from if we recoup for full costs from a rebate perspective and what that looks like before I commit to that, obviously. So what is that the intent of council is to try to recuperate full costs?
Yes.
Yeah.
I would say, yeah.
Okay. So then we would essentially, I would
Especially if
say,
you're responsible after the fact with standardization.
correct, yeah.
You need to standardize it because you're responsible after. If you're taking
You're
liability.
gonna need to know exactly.
That's gonna make it hard.
That's gonna be the hard part, because I'm thinking about some of the jobs that we've had.
It's not gonna be perfect, so we're gonna make more money even if we bill after than if we
Oh, no
bill
question.
upfront,
Just
right?
thinking of
So,
a situation that
like,
comes
when you
through.
think of, like,
but-
contractors and stuff like that, right? They give quotes, this is the estimate. If things change, we bill you for the difference.
Nobody's gonna wanna lean on a brand new house.
No. This
And
is true.
that's kind
Yeah,
of how
this is true.
businesses work, right? Like, that's how
Yeah.
construction works.
And,
now.
and
So I
we,
don't know that we have to
yeah.
reinvent the wheel on a process.
and we are, if somebody's putting in a new culvert, they're building a new home, that's gonna generate additional tax revenue as well.
And I guess the point that's been made, which I think is a valid one, is if we're not charging them for the full amount, then essentially the rest of the residents are
Yeah.
subsidizing this
Yes.
person's new home,
Exactly.
right?
And that's Councilor Glam, I dealt with an individual, that's what we had to explain to them.
Mhm.
So I have a couple of quick questions, and it may have more to do with the bylaw than it does this, but you can tell me if it does. Getting back to culverts, and it depends on the definition of the culvert. I know that in our areas, underneath the part underneath the driveway is the resident's responsibility. So if there's any issues underneath the driveway, like let's say they get the flooding, or there's an issue that needs to be corrected, but it's because of something underneath the driveway, I don't know, plugged up or something fell down or whatever, it's the resident's responsibility to fix. It's not DTI's responsibility to fix. So I don't know whether that's the same here in the village or not, but you at least need to be mindful that there is two different, if you're doing it regardless, here, outside of the village, we're responsible for anything underneath the driveway.
I will say that if you are flooding the road, they will come fix it.
Yeah, only if the road's being
I
flooded.
might.
Experience.
But they might,
Experience.
but they might charge you for that.
No,
Um,
they didn't.
so- And the other thing just to be mindful of, and getting back to, if and when the time comes when the town has to take responsibility for the culverts, for the LSD, they're in absolutely horrific condition.
Like
In
all
my
the roads,
ward,
like all the
they are
roads, I think
horrific.
too.
It's
I think
old, it's
on-
old infrastructure, would be the nice way
But
to say
absolutely,
it.
there, some of them are actually going uphill, so you can't, it doesn't drain anywhere other than.
And there's a wooden one still along the old highway in particular.
It's insane when you see, I've got a video to show you of what one of a, it goes like literally from Coverdale Road during a spring thaw. It is a river going down Fahey, and then any house that's anywhere there, it's just going straight down.
So this will only apply to the former village, who then after installation, we assume ownership of said culvert. So I can't speak to be totally upfront, can't speak exactly to what the specifics are in the outside. I don't know for sure, but
What's been done in.
inside, yeah.
Formally.
Oh, no, and I get that, it's just at some point in time, someone's gonna say, well, here.
Yeah.
You got the other
Right,
ward.
it's a
Could
good
very
point, we'll
well,
have to take that
very
into
well, yeah.
consideration.
And I think we're having those conversations with roads too. We had the same
Yeah.
concern is what happens if in 3 years that happens. But for now, I think ultimately on the motion specifically, my understanding is that we will, on the question of the first motion, as opposed to that, it's directing us essentially to come back
Yep.
with
sounds good.
a way to recuperate costs. And on the second, my understanding that there's no concern on updating the bylaw itself, but that's.
As long as it's not copied and pasted to the outlying areas, then I'm happy with that.
And the schedule is in there to include that we would also assume responsibility for the outside area, so I can assure you, we do
Okay,
not want to.
Don't copy and paste.
Yeah. We do not
Whatever
want
you do,
to,
don't copy and paste.
We do, yeah, we do, but I just.
So on the first, we need to read.
Do we need to
It needs to
amend?
be, yes, yeah, sorry, that's what I was trying to say, is that we need to, on those, we need clarifications, yeah.
So I'm not clear on the process to amend. As the mover, I have to amend? Is that correct? I have to amend the motion, right?
And you have to,
Do I have to
So
just
it's
redo the
still-
motion entirely or?
assuming it could ever happen. So you're amending your motion to read how you want it to read, and the other person has to agree. Or you get a
Seconder.
Okay. So I would like to amend the motion. I don't know, what am I saying?
That
amend
will
the motion
come back to
recover
recuperate
full
pro-
To come back with rates,
or a
To re-
process, it's a
100%
process,
full
not
recovery.
raise, it's a process to recuperate full costs.
for the process to recuperate full cost, whatever that.
Turns out.
Somebody make it sound pretty, please.
So, by
Yeah.
Councilor Delaney.
We know what you
and
meant.
it's Councilor Thorne, I believe, that is Councilor Thorne.
Yes, I agree
Councilor
with that.
Thorne is in agreement. With that, are there any questions to the new motion?
Nope.
All in favor?
Aye.
Contrary minded? Motion carried. Now we have the second.
I'm
second motion.
not moving the next one.
I'll move that council direct administration to bring the proposed bylaw number 5, a bylaw respecting culverts and driveway entrances to an upcoming regular council meeting for introduction, first reading.
Moved by Councilor Dykstra, seconded by Councilor Oblinus. Questions to the motion? No questions to the motion. All in favor?
Aye.
Contrary minded? Motion carried. Streetlights, former local service district.
So another one for direction, I've had a conversation with a couple of you, in particular, the outside, some of the counselors from outside former LSDs. But in essence, we're proposing a process to start looking at streetlights in the outside area. So this is one area that can be done, I would say, relatively quickly in the grand scheme of municipal services and things on the docket per se. And it's something that municipalities will essentially rent from MB Power. So within the village, we have a number of them, the former village, we have a number of them. And I would say before January 1st, had inquiries on a couple of locations in the outside areas. So suspected this would be something on the radar. Given that and the importance of not just putting streetlights on every single pole in the outside area. Our intent is to develop some sort of a process to clarify that, both within and outside Ward 3. But in the meantime, we do know that there are particular areas within the wards that, especially intersections that are problematic from a safety perspective. So our proposal is to work with council, but also the public on identifying some of those, aiming around 10 to 12 per wards in the immediate future, what I would call immediate short-term future. And then in the first committee, the whole meeting in the fall, coming back with a formal process and what that looks like long-term. Obviously, we can guarantee or work towards that process. I can't guarantee that NB Power is going to have a streetlight on the power pole within that time frame, but they're generally within a month. Is that
Yeah,
right?
any of the ones I've ordered for Ward 3 are generally within a month.
So they're generally fairly efficient at getting them. So it, I would say, is optimistic. But our intent for the direction is to look at willingness of council for that process, and appetite amongst council for a formal process, unless there's a more efficient way of managing the requests that will inevitably come in beyond the intent to be proactive. So there's two motions within the recommendation section.
Just a comment before the motion that I think this, going back to Councillor Caldwell's low hanging fruit, this is a easy way to achieve that.
And I like your comment about looking at it from a safety perspective, because while, as an example, you'd never put streetlights all the way along Coverdale Road, but clearly there are aspects of the road where there's safety issues there.
Yeah.
And I wouldn't mind seeing a few strategically located.
We should put a
streetlights.
motion.
I would say we need a motion before we
Yeah.
start making.
I'll make a motion. I move that council direct administration to undertake a public consultation process with elected officials and residents and subsequently work with MB Power to begin installing streetlights primarily at intersections in former LSDs. So moved.
I'll second that.
Word seconded by Councillor Geyser. Questions to the motion?
I have a question. Under the financial considerations, it mentions that the cost of approximately 6156 will be absorbed by the former village subunit.
Correct, because we're proposing a transfer from one of the former village budget lines for this year. We don't know what streetlights will be moving forward, but that's a proposal in item number 7, is to secure those, and if I'm correct, it's coming from a former village subunit budget line.
Is there no variability within the LSD subunits to pay for that?
We would have to calculate depending on each, and that's approximate. We could get maybe 10 streetlights installed, and that's the annual cost too. So that's like, we're already February, like end of February, I guess. So by the time that we get the streetlight installed and on the power account, and we also get them by just account, correct? So it doesn't say streetlight located here. So from a efficiency perspective, it will be challenging to calculate unless they can start specifying them. All we know is that there are no streetlights in the outside areas right now. That's how we know.
Not opposed, I'm just.
It all depends on the
Yeah.
cost on the pole as well, like if it's,
Yeah.
if it's an MB Power pole versus we put in a pole versus, yeah. So
Right.
that's why the costs are a little.
Dependent on, yeah. Further questions on the motion?
I'd be happy not to drive past New England Drive again.
Um,
Every time I go to that subdivision, I drive right past it.
Yeah, that was one of the ones I.
Yeah.
Any additional questions to the motion? All in favor?
Aye.
Contrary-minded? Motion carried. Second motion.
I'll do the second one. Make a motion that council directs administration to draft a proposed streetlight policy to regulate streetlight requests for the whole town for consideration at the September committee of the whole meeting.
Seconded.
Councillor Dysart, seconded by Councillor Thorne. Questions to the motion?
Go for it.
Say Dexter, sorry. Any questions?
Nope.
All in favor?
Aye.
Contrary-minded? Motion carried.
Fire department might have a point of view as well.
Good point.
based on their experience with any accidents that are on any of these roads.
Good point.
Oh, yeah.
Or watering holes for them.
Water pole is a really good,
Good
yeah.
point, yeah. Yep,
Actually, it's a really good point.
we can make sure they're looped into that for sure.
Cause I think those dry hydrants would be a good idea from a,
Yeah.
to have those lit,
Yeah.
if those happen in the future.
Uh-oh.
So moving on to item 6.
Item 6, grant policy.
So I think
But go back up there, it's only gonna give me.
hit that one.
Yeah.
If you hit escape or go,
Click on questions first, so,
Click on what?
click on questions, then hit escape.
So the next item, is a proposed policy to be brought forward, which would be ratified pending council deliberation, input, questions, changes essentially, at a future council meeting. The primary reason we're bringing it now is because we've been holding grant requests to formalize a process. So generally, the former village has budgeted a dollar figure, and allocated grants on a first come, first served basis, thank you. And so we're proposing a formalized process whereby there's a threshold that they can be approved internally to a certain extent, then brought forward to council when it's over that, and at the same time, encourage a more formalized timeline so that we can deliberate initially before we bring forward a proposed budget to council for discussion. We get a series of grant requests that give us direction as to what is being asked for, and then also to encourage essentially multi-year commitment. So as opposed to saying we always give them X amount of dollars, the policy will ensure there's a formalized agreement that whereby it's budgeted for X amount of years, 3 years, 5 years, 10 years, whatever it may be for whatever organization it may be. So it really is to formalize that. So if we go through the slides quickly, that is the overview of what we'll run through. The next is the purpose. So again, to standardize requests, to ensure that applicants are required to show reasoning for why the municipality should be providing funds. So if we go back to the budget discussions, we get 8 cents on the tax dollar. So even comparing from other levels of government, we have limited comparatively funds to move around. But again, also going back to the fact that we're the closest to residents, which puts us in an interesting situation when it comes to things like grants. It will ensure that our grant budget funds can go further and be more predictable for us to be able to budget and track accordingly. It'll put in a process with timelines, measurables, and requirements. That's for staff, for council, and also for the groups and organizations that are applying, many of which in certain instances like a project could rely on support from all levels of government, whatever that might look like. So it's important for them. And it separates requests into 3 main types. So requests less than 250, requests more than 250, and multi-year requests. So sometimes there are some that come in for, if it's $100, it is arguable that may not be worth putting on the agenda for council, and to determine an internal threshold. And you'll see that the policy allocates a certain amount of money annually for those types of requests so that we don't get a million requests of $250 or less. The next slide. So the process proposed in the draft policy for grants of less than $250 is that starting in 2024, which is next budget year, we would recommend earmarking essentially $2,000 a year for grant requests of 250 or less. This is where the approval from council is not required and would be awarded on a first come, first served basis. The policy, like most, essentially would require approval from the CAO, which essentially would be designated in this case to clerk treasurer Diane, where she's the one that's managing these and knows historically what has come in, what has not, and the mayor. So it would require approval from both sides. And then it stipulates only one request, going back to hypothetically, if we got 1 million of these requests in 1 year, the groups can only submit one up until June, where we have a little bit more predictability as to whether or not that $2,000 a year was spent. And then just from a timeline perspective, because it doesn't need council, the timeline would be approximately 2 weeks, as proposed in the policy.
So
The next one.
That'd be only 8 requests of 250, would it not?
It wouldn't be correct unless they submitted it ahead of time. So these are more often what I would call donation requests than actual grant requests.
I'd ask questions to be saved for what's.
For afterwards. So grants of more than 250, and so this is where we try to formalize those specific requests to be able to budget accordingly. So, we would ask by September 30th to be able to be included in the budget. So it would depend obviously on whatever given year. We would essentially work with the requests that we have to bring forward to council. These would be done in the committee of the whole process. And then in the budget, an amount would be allocated essentially for grants accordingly after the fact. They will be notified in December or whenever we would get approval of the budget, which in some instances like this year could be as late as mid-January, but hopefully that will not be the norm. Council will be, again, like I mentioned, be provided an update during committee of the whole, more than likely in October, prior to budget deliberations to identify what groups have requested grants. And so you're not approving awarding grants, you'd be approving them in the grant or in the budget deliberation process, but you'd be agreeing to the allocation in principle of them, and then in the budget deliberations, approving them. So then during the year, funds available remaining would be on a first come, first served basis. But if the dollar amount is over $250, it would require council approval. So it wouldn't necessarily budget only $2,000 plus whatever we get. More than likely, it would probably, pending council approval, if there's something else that needs to be moved to, have more than that. The next slide, continuing on more than 250. So grant requests, so anything that exceeds $1,000 is where we're proposing a threshold where they need to demonstrate connection to the town's strategic plan pillars whenever those are determined. So to really demonstrate that it's not just to help the town that we could often hear, but to specifically strategically demonstrate as to where there is some level of partnership or mutual benefit to the funds being provided. And the timeline is outside of budget deliberations, so eventually it will take a while to get there until we get groups used to it, but eventually it will be primarily during budget deliberations. But for anything outside of that, the timeline is no later than 30 business days before funds are required in order to get on the council agenda. So because it needs to be made at a regular council meeting, it does what I would say slow potentially that process down. Moving into multi-year grants, so grant organizations that are requesting $1,000 or more and know that they could use this or would like to use this every year will be encouraged to apply on a multi-year basis. These would be requested earlier in August, and that is essentially for us from the administration side before it comes to council to work with the groups to say, could you change this? Could you request this? Before it comes to council, in hopes of getting them a favorable level of partnership with the town. There would be as proposed in the policy, a maximum of one multi-year grant request per year. So over 10 years, a group could have 3 different projects on the go and 3 different multi-year grants, but it's limited to 1 request a year. And that's essentially to limit any influx of the budget during the deliberation time. It will be evaluated more stringently, but to, again, demonstrate ROI for the town, so return on investment for us, and again, relate to the strategic plan because it's over that $1,000 limit. And then there's some more from not a liability, but to ensure our due diligence, there's more requirements from making sure that the organization has bylaws, is reporting annually, is financially stable, has letters of support, etc. And those are things that if someone's coming in for a $20,000 a year grant, we would say you should probably bring forward letters of support before that goes to council to show that there's that buy-in. The next slide is just on some generic other elements. So pending direction, our process would be to introduce an online form for these requests, to be funneled through. Excess grants funds would be specifically earmarked to go into our operating reserves to be able to be used for future years. Again, to Councillor Dykstra's question as to if we're limited on those specific requests. We would have the authority in the proposed bylaw to change questions in the policy. So for instance, if the strategic plan pillars change, as opposed to needing to change that the application form could be changed for those types of things. The rollout of the policy from a principal perspective will be rolled out essentially immediately. As mentioned, we have a couple that are in the docket that we're proposing formalizing before we bring them forward. So essentially would act as if it's on a first come, first served, case by case basis essentially for this year, and then budgeting accordingly next year. And also notifying groups and organizations that would be interested of the process to make sure that they can explore potential opportunities for grant requests. And then there is a discussion needed at some point around the specific conversation around donations, because we do get those from time to time. So are those considered grants? That would be needed, that needs to be clarified in the policy, likely in the definition section. So with that, that's the run through of the proposed policy that's included in the package. I would say the easiest is a motion and then discussion, I suspect.
Absolutely, please.
I'll move that council approve / amend the proposed policy for grants for ratification at a future regular council meeting.
So moved by Councillor Loblinus, seconded by Councillor Tory. Questions to the motion? I believe Councillor Dykstra, you had a question or a comment earlier?
Do we have any information specifically on how many requests we are getting, both for sub 250 and above 250?
On an annual basis, I would say it varies. I don't know, we would have it and could pull it. A lot of them are reoccurring. They are reoccurring ones, and right this year, the budget amount is 40,000, 35, and then one was separated because it needed to be a village, former village specific case or expense, sorry. And so generally that budget was not often fully exhausted. Is that right?
I think too, when we start socializing this policy, you're gonna get a lot more people
Absolutely.
that are going to come in.
Absolutely.
Because a lot of times it's the same people, they know
Yeah.
the money is available, they're gonna ask every year, right?
And the beautiful part about this, and this is something that we would have chatted about wanting to get into place, is it puts a little bit more rules of engagement, to be honest with you. The way it works before. It's hard on council to have to make these sometimes decisions where it's not black and white, cut and dried. I like the idea about, having groups and the accountability, tying it back to the strategic plan on what money is going for. In the past, we would have had individuals that every year, because they were the ones that asked for it, to kind of the banner that goes on the back of the hockey jersey. The same individual that would ask every year to do that. But in that case, it was that same individual, but no one else was doing it.
He's the only one that asked.
Well, you can't blame them for asking. That's
No,
all.
absolutely not. So at least this puts a little bit of guidelines around it, and I think from a group perspective, it gives the ability for, as Austin said, to ensure that they've got proper bookkeeping and proper reliability perspective. I just think it's much more streamlined, and it's a good approach. And also from and you guys have noted, I know several of the councillors have noticed, we will sometimes get these requests for that $100 or $200 for something that is, in some cases, a no-brainer, Austin, and sometimes from in most cases, it slows it down from a timing perspective to take it back to council on that vote. So it does allow a little bit more flexibility for the staff to make those decisions. Councillor Stone.
I just wanted to say, that I've sat through one of the Sackville open sessions where they invite those requesting grants before their budget season to come in and present, and I really think it's a great process, and I'm glad we're looking at that, because I think it really opens it up for not only the community to see what's happening, but also the councillors who maybe don't really know where the money's going. And I presented at one of those, and I just think that it's a really great interactive moment. So I like that idea. Great job.
It also gives the individual an opportunity in a public forum to present what it is that they're doing.
Absolutely.
Right, and
a
I
good
think,
job that they're doing.
yeah.
Yeah,
I agree.
it says it's a positive, right?
Right.
I think it's a real,
Yeah.
I think it's and we've chatted about that because we've referred to the same sessions that other communities do, and, we have some really great volunteers that run some really meaningful things for our community, and I do think it's a good opportunity for them to tell their story.
The one addition that I'll make to, I think, Councilor Tory, I think it was you that just mentioned it, when we socialize the policy, that's also the reality of being a larger municipality, is that more questions will come for this type of support. So not-for-profits, for instance, and putting on my former hat from the grant process at the city, will often request because they just know that there's more likelihood. They'll spend more time asking the city for something than Salisbury, but they always ask a review. And so they would always ask both, for instance. And so eventually we will get there. So having something in black and white proactively is beneficial, I would say, for us.
Standardization.
When we say first come, first serve, we're still gonna look at that for merit, right?
Oh, yes, yes,
Well,
yes, yes, yes,
absolutely.
but it's from a timeline perspective, like if someone comes with a great idea in December and the funds are exhausted, the funds are exhausted, based on merit, but.
And
the
it makes
funds
a
are-
really good, unfortunately, that's the way it is, but I also like the idea, kind of what you said about, the individuals, all of a sudden, once they learn the process, they'll come forward. But if we're tying things back to a strategic plan, like over time, there could be low hanging fruit of things that we don't know about. That if they do come forward on them, we can then eventually, at least for the next year, start to look at, these are the opportunities we ran out of budget on that would bring great value to the residents.
So if you know when the new funding is coming, people will be prepared for it, and
Right.
it'll just be so much more smooth now.
Yeah.
Because it all happened at once, because they want funding.
Yeah, yeah, exactly, exactly.
Any additional questions to the motion?
Nope.
All in favor?
Aye.
Contrary minded? Motion carried. Number 7, January financial statements.
I'll pass this one over to Diane, but obviously it's January and there's not very much on the books. It's just still January, but there are some highlights that I'll let her speak to quickly.
I don't want
First
to
up.
read it to you, but obviously, as our CIO mentions, there's not a whole lot in January as of yet. It's mostly the day-to-day regular financing, plus some of the stuff is from 2022 that doesn't come in until January. And then a lot of times you're paying the month ahead and that sort of thing. So it'll be better next month. You'll look at it better next month. Don't know what else you really want to, other than we are opening the accounts today. We had to write our first check on the new checks, so we got our new checks. It's just a matter of us starting to move things over to the new accounts and working that way. So when you look at these reports or budgets, some of the, if you're a numbers person and you're looking at the account numbers, they may change. When the new one goes out.
Can you look at?
Looking at the numbers person down there.
I would
Yeah,
never.
so like I said, the numbers will change, most of the, of course, the departments are the same and that sort of thing. But there are some things that we've put in, to try to align it better with the actual provincial budget so that we know exactly what it's coming out of and that sort of thing. So some of that will be moved in the next little while, bear with me, till it's done. And that's, I don't know if anybody has any major questions about them or.
One addition is that that's because it scared me a little bit. I ran down to Diane's office when I saw it, was
Yeah.
that some of them look like they're way over. That's because they're former budget lines that have not been added. So there's expenses that are budgeted in the new budget that will not put us over budget, but that are being put in like former budget lines for now. So there's some that show that it's like 110% over, whatever that number is, but it's not the case until we formalize those opening of the new accounts essentially.
Street signs one of those?
Right, yes, street signs is one of those, yes, that's because that one is a deposit, so a portion of the deposit will come back.
So can I ask a few questions? These are almost all stupid questions, but I just don't have the answers in my head here. Right at the top, the 345,985 budget, province of New Brunswick, that is,
That's our first check
First check from them.
from PNB. So we get checks monthly for the total.
okay. Okay.
We don't know exactly the total budget yet because they made some adjustments. So the next one actually is in our new account. Is slightly different. It's kind of, they did make some adjustments between January and February. So I don't know exactly what the end result will be yet. That should be out pretty soon.
So,
That'll tell me exactly what every payment is gonna be for the entire year,
That's in the income section, so it's basically, you'll
Yeah.
see that on a monthly.
on a monthly,
Right.
yeah.
so, research and planning studies, what is that? That's at the very bottom of that first page.
Yeah, right now, the research and planning studies, that's our water study.
Okay.
Mainly, yeah.
Okay, and we had something here on winter maintenance that was zero. Under
That,
transportation services, kind of surprised me, I thought.
it's zero as of now because they get paid in
January.
payments,
So they
yeah.
get paid in January.
Yeah,
Okay.
that will jump a large amount when.
You answered a few of a few of the other
Yeah,
questions.
yeah, or-
So looking at it now, and I know it's hard to see because most of the stuff hasn't happened yet.
Mhm.
Is there anything we need to be concerned of after this first month that you're looking at? Not so much individual lines, unless there is one, but generally speaking, I know we're talking about, 4.5% of the total budget being spent right now is that normal? I don't know.
I'll look to you.
I would say
for-
no, that's not,
Yeah.
this is not, there's nothing here that freaks me out.
Okay, okay.
Yeah.
And the last question I had, which I think somebody brought to our attention the other day, but I don't see it anywhere here when we're talking about finances. What's the total debt of the town right now? Like debt?
Be in our principal and interest installments. So I can pull it up right here. Don't have it on.
Our debt ratio is around 4%.
Yeah.
So for debt ratios were 4%.
Of the former
Of
village.
the former village,
Yeah.
yeah,
Yeah.
correct,
Yeah.
correct.
Yeah.
Which is really good.
Very low.
Probably too low.
4% of what?
The debt
Annual
ratio is what they,
The budget, basically,
To your budget.
like the payments that you're making on your outstanding debt.
Okay.
So if you're around
So it'd be-
5%.
our payments would be
you're well
4%.
managed.
Represent 4% of our annual
Revenue.
revenue, okay. That's very
And
low.
they start to look at it, there's a cap on, I think it's a 20.
It'd be good to kind of
There's a
know,
cap on when the capital
I don't know.
planning board will also.
is it $1 million? Is it $100,000? Is it $2 million? I don't know.
And the rates associated.
And yeah, and that's my other
Yeah.
question was the terms and conditions.
I can get you that information.
You don't need to give it for me now. I would just be curious to know what it is.
My only question is,
You don't have
No,
any
it's not.
debentures.
No,
No.
no, it's very minimal. There are some, but it's
We,
very.
we do, but it's not a
very
lot.
minimal.
And we chatted
Compared to
about
what
that as far as
most
even
people
when they're gonna roll off the books.
And the last question I had, which you probably can't answer because I wasn't really sure what this meant, salary corrections. Under the, oh, we are
They're
not
not
there.
there yet.
We're not there
We're
yet.
not there yet.
Oh, sorry.
Yeah, we're not there yet. But just to give you context, like we would have to look at it overall as to when to the mayor's point, flop the books, but our principal installments for this budget year are 88,000, and our interest installments are about 18,000. So it's just like, let's say for give or take about 100,000. Ish.
106.
Just for your payment.
Yeah, it's just the payments, that's right,
Yeah,
yeah.
look
that
at
doesn't
other-
give
That's
us
the payment. That isn't
Yeah.
what your
That's
total
not your-
debt is.
Yeah, no, that's just our installments, just our.
Yeah, yeah, we're looking at, just chatting about this philosophically earlier this week, or maybe it was last week, around when do they roll off the books before you're bringing on new, so you're always.
Trying to keep a steady payment.
It's a good thing, I think, for all of us to know, because
It is.
a resident could ask, like, how much does the town know?
What's the position?
What's the position they're in, right?
And it's even as you start to get into strategic,
Yeah, exactly.
even as you get into strategic planning, you can't bring up.
Well,
much on the books.
well, exactly, when we start talking about some of those bigger expenditures, like, we really need to get
You've
that.
gotta eat the elephant one bite at a time, it's just the reality of,
We're extremely low in comparison to everybody else. I think,
Yes.
right?
We are.
but we have a few things we'd like to try to accomplish, therefore.
We have to do an updated debt profile that we'll send to council anyway, we go to the borrowing board with 2 upcoming items for tenders, one that closes this week, one that closes on Saturday, so also this week, I guess. So,
And you'll get a 5-year, those
Yes, you need
debt
to-
profiles are like
yeah.
5 years. so-
You
The
need
financial
to-
report spells it all out as well.
Yeah.
But we won't get that.
So on this item, there's no acceptance.
No,
no,
it's just,
informational.
it's for information, yeah, and then we'll do them on a monthly basis. Quarterly, you'll get, projections essentially to show you any flags that are coming up, so to winter maintenance, that sort of thing. If we know the payments are coming out, that will skew the numbers from February to March, so on and so forth, we'll flag those, on a quarterly basis.
Just one quick question, the net income of 226,584.87, is that a reoccurring number? Does that fluctuate as the months go by? Just what is that?
Where are you?
Very, very bottom,
The
See
general?
netting.
Of which
360.
page?
Oh, wait.
bottom
Oh, no,
of
the utility. I got
page
you.
41,
Oh.
41.
net income.
That's gonna fluctuate.
Yeah.
But is there a seasonality with that? Is it just, or is that reasonably steady is my question?
It's based on the, like, so for instance, the winter maintenance where when do we pay?
Like
3 times a
3 times
year,
a
so
year.
not
Okay.
quite quarterly, I guess, so, that will offset in March, when we pay the next one, so it will be less, so it fluctuates based on the agreements that are in place. The income is standard for the most part on a monthly
Because we don't have a
basis.
whole lot.
Yeah, for the most part, but most of the expenses are stipulated on, like, the larger ones, the big ticket items are on, like, the service commission is monthly, the winter maintenance contract is 3 times a year, so you'll see those fluctuate based on existing formal agreements,
Our
basically.
CMP always is a big one too,
Yeah.
right? 4 times a year.
Yeah.
You guys don't accrue them so that you're putting the monthly expense in. No,
No.
you just dump it in
Yeah.
when it comes.
Moving on to item number 8, 2023 operating budget reapplication.
So this is inferring to your point, Councillor Totori. And so obviously the budget process was a little bit different this year, as council is very well aware. And as was presented at the start of the year. So with somewhat answers from on a few different items, we're in a position where we're looking for some sort of direction. So again, not formal decision this evening, some sort of direction to figure out, is this realistic? Are there other priorities? In order to essentially use some of the funds that are in budget lines that either will not be used or will not be fully used based on additions, but also omissions. So taking some of those funds and putting them elsewhere, that were completed throughout the budget process. So without going through them line by line, there are, I would say, the majority that are within existing department areas, for instance. So one main one that you'll see is that there is a budget line in transportation that's 150,000 that was added, that was not accounted for, and so we're using that for some proposed reallocations. And there are some that are staying within transportation and some that are not. There are also some lines within this document that are some larger ones. So for instance, our street maintenance and paving, that is 175,000. So it's a larger item, larger budget line, again, within transportation, that we're showing kind of that breakdown of what we expect to spend. So there are no reallocations there, but it gives you some context as to what some of those are, because there were changes in some of them. And so the majority of allocations you'll see in the attachment to the CRF is from that $150,000 transportation line, which are essentially acting on a number of other essentially reports or recommendations made to council. So one of them is around speed radar signs, which was a request that was made last year, and we know that we'll use them again for upcoming closures in particular, and then just from a proactive basis moving forward. Council was sent a water study from the decision of the former village council, and we have some funds budgeted but not enough to proceed with their next step. So they'll be presenting in March. So hypothetically, should council proceed or decide that it's a priority to continue, those funds are essentially where we're proposing they come from. We're proposing adding more funds to renovations if council again prioritizes them, because the funds are limited and it will go fast just with this room alone. To Councillor Totori's point, this will be discussed in a closed session in March first, but we did get an HR audit that was completed when I first came, so that was separate from my position, but that was approved by the former council. So that'll be presented with a whole bunch of HR items in closed on March 13th. Employee manual, the results of those audits, proposed reallocations, and then the recreation master plan that was discussed 2 weeks ago or 3 weeks ago by council. So you can see there's the majority of reallocations within there. All of the required out of department transfers are noted in the last column with yellow highlight, essentially. So these were discussed internally to figure out essentially what funds existed. You'll see at the bottom, there are some other what we're calling variables. So we're not exhausting every single cent that we have in the budget. Obviously, it would not be prudent in February. But there are some that we're in a position where, now that we have a better understanding of our budget, that we would be in a position come November where we would have a lot of these funds remaining, that we would say, I wish we could have done X, Y, Z. And it's obviously too late in December. Obviously, transferring to reserves is not a bad thing, but at the same time, we want to act on some of these priorities this year. So without, again, diving into every single line item, the recommendation here is that essentially council is approving them in principle, but the actual allocations will require a formal motion accordingly. So with that motion, and then I suspect there will be questions.
Motion, please.
I'll move that council approve the proposed budget uses transfers as presented for formal motions at the upcoming regular council meeting.
So moved by Councillor Colwell, seconded by Councillor Alvenus. Questions to the motion?
I don't see the street lights on here. Is it?
It's at the bottom,
It's in the second one. Oh. Man.
under solid waste.
So we did switch, to your point, Councilor Venus, I was wrong. So we did switch that out of a former village subunit to be a specific shared cost. So that would come out of shared cost.
Okay.
Because it comes, that solid waste is considered a shared service.
Any additional questions to the motion? All in favor?
Aye.
Contrary minded? Motion carried. Item number 9, G&B 2024 budget consultation.
So in the council package, there is the consultation document from the province. So this is a formality that they do on an annual basis prior to their budget season. We're recommending a proposed letter that's included in the package. I will note that we will it'll be on the consent agenda, going back to that, to be formally on the record as being adopted, but it will be submitted pending direction, unless the direction is to not submit by the deadline, which is tomorrow, the end of February. So based on their consultation timelines, we were preparing a short notice submission, I would say. And it is open to residents as well. That was circulated to council, and obviously we would encourage you to submit on an individual basis and also encourage residents to submit one as well. But they're looking for a series, I think it's 5, I believe. 5 questions specifically. We've addressed a few of them within the proposed letter on a high level basis, of course. But with that, I would say we do the motion and dive into any specifics. If there's any additions, concerns, or direction otherwise as it relates to the letter.
I can make that motion. I move that council approve the draft letter to the government of New Brunswick for the 2023 budget priorities and direct administration to send the submission to the province. So moved.
By Councilor Warren, seconded by Councilor Bland. Questions to the motion?
Thought it was a nice letter.
Yeah, it's very.
Great job.
Thank you, Scott, for your help with the.
Great job, Scott.
words.
If we have any suggestions to potentially add to that letter?
Yeah.
Can we just send them into you or?
Absolutely, yeah, absolutely. I would say we're gonna send it tomorrow, so if you
Sending
can
it
send it in the
tomorrow,
morning,
yeah.
that would be ideal.
Yeah.
That would be ideal.
It'll probably be noontime
Yeah,
maybe by
perfect.
then?
Yeah, we
We
can,
can also submit our own.
absolutely,
Yes, you
yeah,
can submit individually
Yeah.
for sure.
If you don't get it by noon, I'll do it myself.
okay, You can, let's say noon, but if you think you're working on one and it's not noon, we'll hit send on you.
Yeah.
Just keep us posted. Keep us posted.
No additional questions to the motion. All in favor?
Aye.
Contrary minded? Motion carried. Now we will move into discussion. I need a motion for it on financial 68(1)(c) Local Governance Act.
So moved.
So moved by Councillor Thorne, seconded by Councillor Dykstra. Now we into closed. Tori?
Yep.
All in favor?
Aye.
Reminded, we move back into meeting.
No, we just did.
It's on, yeah, it's on it, we're good, yeah. I'm on item 6.
Yep.
Okay, we're back in session. I will move to item 6, councillor items.
Oh, I had a,
Nobody said anything.
Okay, just on behalf.
I think you did have one.
Oh.
I just wanna, if you could give us an update on the mail out.
Yes, we got the first draft from the designer today. So I don't know where it was when I went through, I think it's on, okay, so we're on the last stage and we should be able to give the designer feedback tomorrow. The printer's lined up to get it by Wednesday, and then he's giving me a timeline. He said hopefully by tomorrow morning he'll have it. So we should be able to circulate something tomorrow.
So it would be nice for us to know, if we can know, that it's being delivered on such,
Yes, that's what
around
he's gonna
such and
give me
such a
tomorrow.
date, because then we can use whatever
Yep.
avenues that we have to try to give residents a heads up that, look, when you get this, please don't throw it away.
Yeah.
Look at it, read it,
We'll be able to post the PDF too, and she has it designed that, like, it's so when it's posted online, like if you're clicking on a URL or whatever, it'll open, so it's not like it's basically the same as if it's a normal document hyperlink, so we'll just post that online, you'll be able to use that while it's also hitting the mailboxes for those that may not see it online. So yeah, we should be in a position to circulate something tomorrow. Let's say maybe Wednesday, but my hope is to have something to the printer Wednesday, and I should have a timeline for delivery. He said hopefully tomorrow from the printer as well. That's contingent on Canada Post, but he's checking on it. Cool. Yeah.
And I just had one thing just on behalf of council. Oh, sorry, go ahead, Castillo.
Okay, sorry. I just wanted to share a couple of kudos on a couple of athletes in our community because we have, I know Mayor Campbell has shared this as well, but Lily Brown is
Yeah.
gonna be on the very first Canada Games women's
Yeah.
boxing team, which is a phenomenal
Yeah.
accomplishment.
Yeah.
And then we had, two
Oh,
of
with
our,
names. Be careful with names.
Yeah. We usually refrain from using names, but I think this is on public record that she has done so.
Yes.
Her mother actually had asked for some recognition on this, so.
can I provide names of the other athletes?
Posted
Yeah.
publicly.
It's posted publicly, so.
So we have two varsity women that were also, selected as NBI AA All-Stars,
Yeah.
right, for our high school, which is great. And one of them, Sadie Enstrom and Brooke Melanson, and Brooke Melanson won, Player of the Year, right, for NBIAA for the Eastern Conference, which is a big deal, so,
It is a big deal.
yeah.
It's a
I think
huge deal.
it's phenomenal to see athletes like going to those levels here, so.
It is, and actually Lily's sister had won bronze nationally in boxing recently as well, so a lot of great athletes here. And just on another, very quickly, just on behalf of our council, I'd just like to extend some thanks and kudos to Deputy Minister Ryan Donahue from Local Governance Office, or the Deputy Minister of Local Governance, that has been appointed as the Deputy Minister for Education for the province, and I think that's recognition of his hard work on the reform that we've seen take place, and he was a great person to work with that made the process a lot easier during difficult times. So just wanted to congratulate him. All I had. And with that, do I have a motion to adjourn?
So moved.
So moved by Councilor Thor, second by Councilor Martinez.